So to pay tribute to all of you that actually came here on time, we will start. And this plenary will actually, this kind of the first of the two plenaries, well, the row of plenaries will actually be about the topic of the conference this year, sharing innovation across sectors. And we will have many sectors presented today, up to 22, isn't it? 22 sectors will be presented and 6 countries. So stay awake, and we will have first presentations, and then all the Q&A and the discussion will be saved for the panel in the end. So let us start with Prosper, talking about the cross-sector use cases, key responses to measure the SDGs. And then we will continue with Malawi, with the Ministry of Agriculture. Then we'll continue with Jørn, talking about zoonosis in DRC. Then we will end up with John and Sam, we'll see, talking about climate health and also civil registry from Laos. Okay.
Okay. Good morning. Okay. There is still more coffee out there, so if we could pick some coffee and come with it. Yeah. So good morning and welcome to the final day. A great opportunity for us to be sharing with you the sharings and the cross sectors that we're talking about. So I'm here just putting on big shoes for 3 countries. Again, this already shows the sharing we already have, that I'm able to present all the 3 use cases in the 3 countries. The sharing has already started happening. So I will be sharing the different cross-sector implementations in the different countries. And when we talk about cross-sector, we're talking about more than one government, more than one ministry, more than one institution in a country. So most of us have been talking about health. Education came in last year, but now we're talking about, all these so many that I'm going to share. So this is a compilation of summaries from the 2 powerful implementations that have really driven DHIS2 crazy, as we shall share, but also produced some good insight to what we can be able to do in terms of improving the DHIS2 to monitor and have it as a digital public good. So when we talk about cross-sector, this is the mess that we are in. You talk about health, you talk about environment, you talk about climate health, you talk about education, you talk about finance, you talk about sports. All these so many sectors is what we're looking at. So a little piece of this has been picked in Uganda and in Rwanda and in Ethiopia. And we're going to share with you to see how the DHIS2 is really helping in terms of bringing the data together for triangulation and being able to monitor the government programs. So DHIS2 is in the center of this, getting all this data, exchanging the data, managing the data, visualizing the data in these different sectors. So these are the different 3 use cases. And again, there could be more. We didn't go out to look for many, but these are the 3 use cases that we already know right now that have been shared in the different parallel sessions. We look at Ethiopia at a level of a district cross-sector implementation, and really using the basis of DHIS2 to drive this implementation. So they are looking to see, and they have been able to use the DHIS2 for health and build on other sectors like agriculture and the rest, as we shall see, to be able to monitor the key performing indicators for what they have as a transformation agenda, trying to be able to improve the social welfare of the different districts. And so they are bringing all these 2 sectors, these 3 or 4 sectors, to be able to look at data translated together. Then we move to Rwanda, where it's looking at more on the local government that could also be below the district. And really looking at how you can be able to monitor accountability across the different local governments, even to the grassroots of where they have the lowest, they are operating at the lowest political entity, to be able to monitor innovation. So here you have targets being set by the different governments with funds allocated, and then moving from village to village to be able to monitor these indicators. So you find a mix of implementations where villages or local government have different targets and set of indicators that you are monitoring, and we'll also be able to see how this is implemented, especially how DHIS2 is really supporting this kind of implementation, moving from the paper-based kind of monitoring to now an electronic monitoring for a local government. Then we come to Uganda, which has all the mixes from the national level also up to the grassroots, where we are monitoring the national development plan. So governments also have their national development plans. So for us, we are on plan 3, which is towards the Vision 2040. And here we are looking at all the sectors actually in the country, as I shared in the previous slide. And also a new initiative, which is also looking at the parish development model, where the different parishes are given grants and they're supposed to use them, and then we're able to monitor what happens. So this is how the DHIS2 now comes into the mix of all these things. And as we talk, there are quite a number of systems, as we all know, in the different governments. So we have to exchange data between them. Like if we miss the finance system, so that has to be, exchanged from those systems. So what motivated us to really use DHIS2 in these 3 countries, and again, even more that are coming? So for most of these implementation, I may not want to talk about how much it had costed them to be able to decide whether to go for DHIS2, but a lot of our local governments and our governments have been depending on vendor systems, which have been quite expensive. In one of the countries, the last vendor before DHIS2 had only used all the funds to do requirements gathering, and they stopped there. So the DHIS took up the requirements gathering, and the requirements gathered, and they were able to use it. So we find a lot of challenges in terms of how much it has been costing the governments to be able to develop these systems, maintain them with expatriates. Most of them are expatriate driven. Do the upgrades. We've seen somewhere where people have to be flown into the country to just adjust one data element. And also sometimes functionality, especially around visualization. That has also been one of the biggest motivator of the DHIS2. Then, of course, the local expertise that are in the country that have been able to demonstrate the functionality, the capabilities, the sustainability model of DHIS2. We have, of course, our HISP groups that have been in the 3 countries, but also most importantly, the teams that we have been able to train over time. I think when you look at our academy training database, we are almost now over 10,000 or something like that. And these people have already been trained in the use of DHIS2, and they're all, out in the countries there. Then, of course, thanks to the ministries of health in these countries that have really implemented DHIS2 for over 10 years. So a government looking at an implementation which has been stable for 10 years really gives them the confidence to go for this solution. Then, of course, the flexibility around DHIS2 that you can be able to even add on top scripts, apps, plugins to support extra functionality. Because when you get to these sectors, we find quite different requirements that are not supported by the core. Then, of course, also the track record in health, as I've shared, but most importantly, around COVID. The COVID implementations in these countries really drove the cross-sector implementation. So in this, in the instance that we are running, in the implementation that we are running for COVID, we just realized that we were able to bring the different sectors. For Uganda, we talk about education and health. For Rwanda, we talk about, the immigration and all these other sectors. So these have also been one of the key, and also having also these other extension that we had already started, the education as we've talked about, the judiciary in Uganda, monitoring how many cases have been addressed, the social protection and agriculture in Malawi, as you've shared, and environment and minerals in Rwanda. So this has also been able to give the confidence of the governments that these systems can be able to work in the government. So in terms of progress, just give a snapshot. The implementations are up and running. For Ethiopia, they have been able to customize this on top of the DHIS2 for education, added those different sectors, and they're able to translate the data, been able to pilot, and now moving to more of the districts, what they call their welders. For Rwanda, they never pilot, but this one they did some pilots, but the pilot here is really to inform the next implementation. So much as they talk about a pilot, it is just a whole, administrative unit with all the different levels. And this is just being used to be able to implement in the next. As I shared for Rwanda, they have different indicators almost for a different sub-unit as they move from one province to another province. For Uganda, the configuration has also been completed for all the NDP target indicators, over 5,000 indicators into the system, because we're looking at all the sectors. And the targets, because they've been able to set the targets for each year until 2040, all the targets have been put in the system. And then for the previous 2 financial years, that has been uploaded. And now the rollout and the training is ongoing in all these different sectors. And for Uganda, because they want this to be, you see, we're going up 2040. So for us to be able to sustain it, there is an initiation of an MOU between HISP and the Office of the Prime Minister to be able to support this as we keep monitoring the progress. Now, of course, there's challenges, not so many though, just 4 of them for now. The challenge we faced a little bit is the standardization of indicators. As we know from health, you've had this one HMIS tool. It's the same everywhere you go. But here you find that the indicators probably could even be the same, defined different from one sector, from one implementation site to another implementation site. So you'll find that we have quite a lot of multiple data elements, data sets, indicators. That's why they become so many, because sometimes they slightly change as you move. But again, DHIS2 with its robustness, we are able to cater for that. That the mitigations are what is in blue. Then there are some of the unique functionalities and features that the governments may want in terms of security, in terms of visualization, in terms of data capture. But we've been able to solve this by just adding a few apps on top of DHIS2 that could be, soon implemented in the core. Then insufficient funds for implementation. Again, as you see, this is talking about more than one sector. We've been struggling with health alone, but now if you're going to train the whole country, all the ministries and so on, it becomes quite challenging and it requires a lot of budget. So we've been trying to do a lot of online training, thanks to COVID for teaching us that. And we've also been developing user guides, which are very simple to use. And then also the e-learning platforms. Moodle has also been very key in this. We've really been able to do this. And then also the YouTube videos that have been shared with these ministries for them to be able to get the training. Then interoperability with multiple systems, some of which are very sensitive in terms of data sharing. You talk about, this ministry sharing their budget with the other one, they may not be able to want to look at that. So some of the things we've been able to do is just, sometimes we export and import with Excel. Lessons learned, lastly, this is a quote from Lars, I think that was in 2011, where I said, everything is possible in DHIS2. And I took that, as a as a quote in the Bible, and we've been using it, and that's why we've been able to really push DHIS2 beyond. So with DHIS2, everything is possible. I think the great platform that we have here in terms of what you can be able to add and how you can be able to switch it, to turn it around, has been one of the lessons learned. We can have apps on top of it, we can have scripts, we can have plugins. Data triangulation, very key. Imagine when you're sitting and you're able to look at all the different sectors. Like when it comes to health, you want to look at agriculture, how it contributes to your nutrition programs, and education, how it contributes to your immunization programs. Then again, this has also, sparked up a lot of interest. We already have Gambia and Malawi knocking on the door. Before we finish these implementations, Gambia is already now up in actually the demo was already set up yesterday, prototype to be shared with the government to be able to look at that. Institutionalization is also very key. We really need to build the capacity within an institute. Like for now, for the government, this is a big undertaking. So MOUs are important, and then establishing formal working environments within the MOUs that we're talking about. Just a quick snapshot of what you can be able to visualize. This could be all the different indicators that you can bring on the dashboard. Here you can have a scorecard looking at your different ministries and quickly look out for the reds. This is one of the beautiful dashboard that you will find in the president's office, looking at, how the sector is performing in the different the directives for the manifesto they are running. And then lastly, in terms of appreciation, we really want to thank the governments that have been able to participate with us in this. The government of Ethiopia, Rwanda, and Uganda for really taking this bold step. And I think they are not regretting as we talk to them. We had a nice presentation from Uganda and Rwanda and Ethiopia the other day. The national and the regional implementation units that we have in these countries, the districts, ministries, and all that. The development partners that have funded this, European Union has been funding Uganda, and is now funding the implementation in Gambia. Then the HISP groups that have taken this work on Rwanda, Ethiopia, and Uganda, and also the UIO teams that we've been also, disturbing and telling them, we need this. And when they say that we can't do it, we say, okay, the DHIS2 can do everything, so we shall be able to fix it. Thank you very much. And
thank you so much, Prosper. I forgot to say that Prosper is representing HISP Uganda, but you all know that, I think. So let us welcome Jennifer Nkosi from Ministry of Agriculture of Malawi, talking about the NAMIS project. We heard a bit about the NAMIS project last year as well. We even have a PhD student that will start up working on this project from Malawi, from the same team, coming to Oslo in August. And also have to mention that these projects that Prosper was presented also have PhD students that are studying, because we really think this is kind of super interesting, and I think it's spot on for the sharing on innovation across sector. It's a good example. So over to you, Jennifer.
Thank you very much, Kristen. Hello, everyone. Hello. Yes, thank you very much for having me and to share what we are doing. How we are using the DHIS2 in the agriculture sector, in the Ministry of Agriculture in Malawi. So my name is Jennifer Nkosi. I'm an economist, and also I'm the one who is coordinating the NAMIS system in the ministry. So let me begin by saying that I have a friend, a colleague, who usually comes to my office and say, Jennifer, I love NAMIS system. I love the functionalities of the DHIS2 platform, how I'm able to utilize it at district level. So that's why I'm here to share with you why we love NAMIS and why we think the DHIS2, it's a good platform to utilize in different sectors, including agriculture. So NAMIS, our vision is that it's a one-stop system where you will find different data sources, different data sets to do with climate, data to do with marketing, production, and the system we are collecting data at lower level by the extension workers, are the ones who are collecting data. And the data is either collected aggregate data or it's individual level data. In this system, we are making sure that end of the day, it's being utilized by different stakeholders in the ministry, including the farmers as well, including the academia, the research institution. So at the end of that, we also are developing a public portal where we want to share some of the analytics, the reports that will be generating through the system. So just a quick update of what we have achieved in terms of the implementation. So we have rolled out 12 modules out of the 18. And I know that as we be going in the future, the 18 modules is going to increase based on the needs of different users and stakeholders. But currently right now we are at 12 modules. And one of the modules that has gained momentum in our ministry, it's the household registration. And as of now, we have registered over 807,000 households. And this system we're implementing in 12 out of 28 districts. And 1,622 devices, translating to the number of staff that were trained and that are collecting the agriculture data in the system. So this is just a snapshot of the household registration, as I indicated. It's one of the modules that the ministry and even the donors in our sector are interested because we are able to collect detailed information to do with the household demographics, the enterprises, the households are involved, even the support that they are able to receive from NGOs and support from also from government projects. And this is assisting us in terms of targeting and programming different projects based on the information that we are collecting at household level. And also from this household registration, we have learned more in terms of the capability of the DHIS2 platform because we have been able to develop customized application on top of the DHIS2 to facilitate in terms of sampling of the households and those sampled households, allowing them to different programs, for example, food situation assessment that we do bi-weekly, and also production estimates that we collect every quarter, and that is an annual exercise. So my presentation today will focus on the key modules, what we are doing and what we want to do moving forward. We have 3 modules. We have the meteorology, looking at weather and climate data. We have the farmer organization, household registration. It's one of that. It's in one of the modules. It's one of it. We have lead farmer. These are the ones, the farmers that work with extension workers in delivery of extension messages, and also a module to do with animal health and livestock. Here we are looking at disease outbreak and livestock production estimates and other data information that we are collecting in the 3 modules. So to start with the weather and climate efforts that we have started under NAMIS, we want to have a better weather data collection at community level. That's our vision. Currently, we are just collecting rainfall data, but we want to go more and be able to collect other weather parameters, including temperature and humidity. Also, our vision is that based on the information that we are collecting on weather and climate should guide us on farming practices and pest disease management and other resource allocations from national level to household level. And also we are looking at combined analytics, how we can link weather with crop, animal nutrition data sets, because I know that weather has a direct effect on crop, animal, and nutritional aspects. Yeah. Then also we are looking at linking the climate efforts that we have through extension services and the mode of farmers that we are registering, the lead farmers and the farmer field skills. So what we want is that we collect this climate data, we analyze it, we develop extension services, extension messages based on the climate products and that we have developed. And for that, we will be share to the farmers. So that will help us in documentation of the best practices based on the information that we are collecting on the weather and climate data, and also support mentorship efforts. So the tools and the work that we have done in the numbers. So on weather and climate data, we have configured 379 weather stations as part of the reporting hierarchy, and this is being collected at community level. So we have data at lowest point as possible. And climate efforts through extension services, we have currently registered 6,603 lead farmers and 85 farmer field schools. And since the activity of the registration is ongoing, we expect that the number of these lead farmers and the farmer field schools, it's going to increase. So as I said earlier, these the lead farmers and the farmer field schools, we're using them as a model. They are used in dissemination of agricultural technologies and messages. And also we're able to monitor and map the interventions that are being implemented by the lead farmers and the farmer field school. So this is just a snapshot of some of the analytics, the visualizations that we are generating using the NAMA system, the rainfall that we collected last season and this season. And also, this is also a visualization showing the number of lead farmers that we have registered per district. And the analysis can even go to the lowest point of data collection. So we can be able to know that in this specific area, we have this number of lead farmers. So that will help us in terms of better programming and targeting. And the other modules that also we have in the NAMI system, it's the livestock and the animal health. So as I said, in this module, we are looking at the production aspect, and also we are looking at the animal health aspect in terms of the disease outbreak. And in terms of we have currently started with the production, collecting of production of different livestock. And under this questionnaire, we're also able to collect some different dynamics of different livestock that we keep in our communities. So we are able also to know in terms of how many dogs have died due to rabies, how many people have been bitten by dogs. So it's one of the parameters that we are able to track under the production questionnaire, but we have a set of data sets that go into details in terms of animal disease outbreak. So that's where we are going in terms of further configuration of the animal disease, animal health, in terms of monitoring and surveillance of the animal health. Yeah. So we also work with the Ministry of Health in different portfolios, whether to do with nutrition, whether to do with disease outbreak in terms of zoonotic diseases. So we also have identified opportunities for community level One Health efforts. So we are looking at us as a ministry being able to provide climatic data to the Ministry of Health, and for them to be able to utilize that information that we collect by the extension workers for their own systems. And also we are looking at guiding efforts on how we can link between climate change, food production that affects human nutrition and health. And also we have the One Healthy surveillance that as a ministry, we are part of the team that we do work together in terms of surveillance of zoonotic diseases. So we are looking at cross-sector analysis of disease patterns using the system. And also on the human health and labor availability, we're also looking at cross-sector analysis of disease burden impact on agricultural labor availability, that if a person is malnutritioned, that will also affect in terms of productivity in the agriculture sector because of labor availability. So we want to create a synergy where we can work together to have a one platform where we can be collecting different informations and be able to utilize in our own respective sectors. So what are the new and future efforts that we have started and also we envisioned moving forward? We want to start importing a 10-year rainfall data. We have managed to gather historical data for 10 years on rainfall data, but also that's one of the challenges that we are currently facing because we are migrating from paper-based to electronic. So to gather the paper-based historical data has been a challenge. And also we are in partnership with the University of Malawi's Center for Resilience Agri-Food System. Here we are looking at the center providing capacity development for our staff in the ministry in terms of how we can further develop the system and also utilization of the system. And also we are looking at development of automated instruments for additional weather parameters. As we already indicated, we are just focusing on the rainfall data currently. In collaboration with the University of Oslo, as already indicated by Kristen, they have identified a PhD student that would do research on the NAMES system. And also collaboration with the Ministry of Health on common areas of efforts at community level using the One Healthy platform together with the NAMES system. Lastly, we cannot forget the ones that they are mandated to generate climate information. We work together, so we want to have, want the department to be able to disseminate more contextualized and actionable climate products to the farmers, because currently the climate products that they are producing, it's at high level, at national level, but we want to find a way of how we can, the analysis should go as low as to the community level when they are developing their climate products. And lastly, we want NAMIS not to be a system only that generates data, but we want also this system to benefit the farmers who we are getting the information. So we want this system whereby when you collect that information, we should be able to send back the feedback in terms of giving them the update, generating extension messages, coming up with extension technologies on how they can benefit in their livelihood in terms of agriculture production and productivity. So we don't want to be a one-way, but it has to be a two-way, whereby they give us the information, we utilize it, and we give them back, and they benefit from the system. Thank you very much.
Super, Jennifer. Very, very interesting and on-the-spot presentation for this session. And this is a good transition over to Jørn that will talk more about animal health. It was introduced here, and we will go more into depth of the zoonosis for the DRC. Yeah. And Kenya, sorry. So then we have 7 countries, more countries. And we will have, so write down your questions. If, we save it for the time of the panel to discuss and to ask questions. And I have many of them to Jennifer, but we can also use the coffee break.
Next one here. Yeah, good morning, everybody. I'm about to talk about One Health and the One Health approach, but with a focus on animal health, in fact, because if we want to achieve something on the One Health side, we need to also maybe put more emphasis on the animal health, because that's kind of the little brother in the terms of health information system. So we start by comparing the domains of animal health with the human health surveillance. So to see what are the differences, because if you just take the approach from human health and try to implement it in animal health, it doesn't necessarily pay off very well. So we are looking into lessons from Kenya, and we have a pilot project working in DRC, which we then try to apply the learnings to. So first then, why this animal health surveillance is important. And well, yes, even though there are some questions around COVID, we can say that anyway, that it's kind of the transmission between animals and humans that is the focus. We have more obvious things like anthrax, Rift Valley fever, monkeypox, and talking about DRC, Ebola, of course, is an important reason for looking at early warning and this health security. So the general approach is then to integrate animal and human health surveillance into a One Health approach. And the reason why we want to focus a bit on animal health, because that is the poorest developed partner in this partnership. Lesson from Kenya: they have a system with the paper and electronic reporting, surveillance data, and surveillance is very much about a little interesting for us to try to fight against all the zeros in the general HIS, because here is a kind of a compulsory zero reporting. They want to see whether a disease is not present. That's kind of a very important part of the disease surveillance in this system. And the end users of the system, that's veterinarian officers and users. They are at farms, slaughterhouses, and they're using mobile data for data entry. So the digital system has the potential to give real-time data. But the problem is that it's not it's well implemented, but it's not well functioning. And we will look into why, because this is leading to serious underreporting and gaps in reporting. So discussing with the people involved in this system and possible causes for this poor performance, suboptimal performance, is of course that maybe particularly in Kenya, then you have complexities between the wild animals, wildlife, and domestic animals, and the reporting across and within is not it's causing problems. And then we also see what we have also learned to observe a lot in the more well-known HMIS reporting, that is that poor reporting structures. If no data reported, then we get no complaints, as people are saying, and you can stop reporting and you hear nothing that from the level above you. So it's passive reporting is a general problem, and maybe because it's about animals and it's maybe not so focused on say the economic aspects of the farms and and cattle farming, for example, there's no urgency around reporting. So it's not what they say, not so very compulsory to report. And that is then, of course, resulting in underreporting. And it's also poor connection with human health. And see that human health is more concerned with zoonotic diseases than the veterinarian and animal health are. Maybe that is an important thing to address, because of course farmers, animal health, they are more interested in the economy of things than necessarily to focus on the few diseases that are transmittable to humans. And also what they complain a bit is that One Health is very often understood that human health people trying to educate the kind of the animal health people. So that's some kind of disagreement between the camps. So these are then lessons from Kenya, and then we move to DRC and see how we can apply these lessons to strengthen in particular the animal side of things in DRC. So of course DRC is known as a hotspot for zoonotic diseases, and a great concern when it comes to kind of disease surveillance and health security. We have Ebola, and then just now we have monkeypox from DRC. And DRC has used this global FAO system for some time. That's Impress is one, and this is about reporting to FAO at the headquarters. But based on rabies projects in one province, Congo Central, in DRC, they used DHIS, but at a global instance, and then they wanted to make it local, and we started to work with them and to expand from rabies to more general animal health surveillance. And when it comes to the other part, and in One Health approach, the Minister of Health in DRC have used DHIS2 since 2015. So we started then last year, late in the year, with the Ministry of Livestock and Fisheries in this Congo Central, and a university in Kinshasa, the Pedagogic University of Kinshasa. And then we worked on putting up a local instance in for this province on animal health, and to having as an objective to work on an integrated dashboard on zoonotic diseases with the human health and animal health. So the project then customized DHIS for the animal health surveillance, the pilot, and to make it interoperable with the what is the GART, that was the rabies system, and so that you don't have to enter the data twice, and to make the system interoperable with the FAO system. And of course, also to work on this integrated dashboard with the general HMIs in DRC. Challenges in DRC when it comes to this animal health part. Of course, also in particular, maybe in the DRC, the information system in animal health sector is much less structured than the human health, because the human health or the general HMIs and HIS is established with a basis in the health facilities and more or less dedicated HIS officers who are responsible for data reporting, etc. But you don't have anything like that in the human health. if you look beyond the last administrative structure, you have farms, you have people, and that is, of course, a source for some challenges. And of course, in the DRC, you don't have many veterinarians. You have trained animal health surveillance officers that are responsible for so-called sectors. Come back to that. And the problem is, of course, that the structure of reporting, the hierarchy, as we call it in DHIS2 lingo, is different between the two sectors. So it's difficult to correlate data. So you need to manage multiple hierarchies to continue in the DHIS2 lingo. So that is a challenge. And the paper-based system and the computer-based system are not well developed. And also there's less stakeholders, including donors, etc., that are interested in the animal health as compared with the human health. If you look at the structure between human health, you have on the human health hierarchy as the reporting structure and hierarchy, you have the provincial central, you have the province, you have something they call zone de santé, which is a bit like a district, and you have aire de santé, and at the base you have formation sanitaire, or that's the facility. You have the facilities, and then up to the air and to the zone de santé, to the province. And if you compare with the animal health hierarchy, you have territoire, which is then either many territoires in one zone de santé, or one-to-one, or even the opposite, and that makes things complicated. And the same between the sector and the aire de santé. So that is the complexity. Yeah. Okay. Implementation. Actually, it's been working since last year, and they have supervision, starting with training and supervision every quarter. That is still working. Of course, depending on funding, how this is continuing. Here we have a screenshot of One Health notification dashboard, where you have monkeypox, rabies, African swine fever, among others. So the system is working and collecting data. If you look at the way forward, important areas is to test out generally this aggregate health reporting. What is something we have found out is very important is to make the system more generally useful for the agriculture sector, for the animal health sector, and to include also other M&E indicators that might be important, and increase the usability for those who are interested in the animal health, so that you get a stronger animal health system in order to integrate it well with the human health. So include more and more, make information output for multiple stakeholders, farmers, local government, traditional structures, etc., is important. And to collaborate with the human health on the zoonotic dashboards, that's obvious. And work on integrating climate data, environmental data, and thereby to expand the One Health approach and make it more vibrant, to put it that way, because animal health is, I mean, maybe more, I mean, the climate and environment, etc., maybe more directly, have more direct impact on animal health than most other areas. So that is important to work on expanding the One Health approach.
Thank you, Jørn. Super interesting, and I hope we will have time in the panel, depending on John's time consuming. But very interesting to expand our area of health, that also the importance of animal health in the whole One Health concept. So that's very interesting. So now John will go from Africa to Asia and talk about two initiatives in Laos, both the climate health initiative as well as civil registry.
Thanks, Christine. So I will not take a long time. I will just try to finish as soon as possible so that we can have more discussion.
Not too fast though.
Too fast. Okay, 10 minutes. So I just want to, my name is John Lewis from HIS Vietnam, a part of HIS Asia Hub and part of University of Oslo. Been working with the DHIS2 for quite some time. I just want to give a bit of background about Laos. So Laos, we first started in 2013, and now it's been 10 years. We just recently celebrated our 10 years implementation of DHIS2 in Laos. We started with Ann and with all the people on establishing DHIS2 core team, made sure all the people are there, integrated with the different programs, started slowly building the digital health strategy, HIS strategy, and e-health strategy in 2014 and 15. And then in 2016 was building the provincial core team, district core teams, and other things, and also tried to include different programs like EPI, NCLE, and other things. And then in 2020 onwards, it was more about how do we integrate with other different ministries and include all the other data, which is essential for health information system. This is just a few slides, what is there inside DHIS2 and what is there outside in the country, and how the data can be linked or work together in using a public dashboard or using internal mechanism or things. I'm not going to give all the description about what we're trying to do, but focusing on enhancing the health system resilient on building the early warning system for climate sensitive data. So this is something which WHO Laos, along with disease surveillance team and with the Ministry of Health and with the climate data, we've been trying to work together. First thing is to impact on the climate change. The climate change vulnerability is to have the climate sensitive diseases. Laos actually is a landlocked country next to Vietnam, and it has a long river and all things, and it's a border between Vietnam, Cambodia, Myanmar, and Thailand. So now what's happening? We are just seeing also the climate change in Oslo. We never had so good weather. Usually when we just say summer, we have 48 hours of summer. So now we have at least 4 weeks of really hot weather. Same, it's happening in Laos. Its rainy seasons are getting shorter and more intense. So that's related to the floods and more frequently the large dengue outbreak. So we're just giving what's happening based on the climate. And also the drier season is getting longer or more warmer. It was 42 degrees, which was reported just a few weeks back in Laos. So it is affecting the agriculture, the food security, the rural population. And it also has very close correlations between the waterborne diseases in the dry season, which accounts for 11% of death among children under 5. So the health worker already know that there is a direct correlation between climate change and the health. But what we can try to do, how do we build that one in a routine health information system, or how we can try to help them up? So the first thing, we worked with NCLE program to strengthen the disease surveillance data in DHIS2. They've been using quite well. So they started with their Excel sheet, and then they saw the potential of DHIS2. They've been using it. They're also now been using not only the event-based surveillance, but also indicate-based surveillance. And then what we did is to host. We went to the Ministry of Natural Resources and Environment, got all the climate data, put it into DHIS2, both the min and max, and also the average rainfall in DHIS2 itself. And then we worked with the University of Gothenburg on early warning system, which combines the data from the climate and the rainfall and predicts when can it predicts the outbreak in both in diarrhea and dengue. So that's the model we've been trying to work on. And our colleague around here, Jason Pickering, is working very closely how this tool can be useful, not only for the Lao, but as a generic tool which can be used in any DHIS2 instance. So this is what has been happening right now. And we've been trying to working on this automatic data exchange between DHIS2 and EWON, and also have a very strong linkages between Ministry of Health Resources and Environment. So this is just a few things like how it works. Here, like DHIS2 is collecting daily in the event base, the disease surveillance data, and we also combine to weekly. The rainfall and the things are the daily data, which we are also putting it down, but we are analyzing only by weekly basis. In Lao, there are not so many weather stations. We have weather station, but like in 4 or 6 different places in the whole country. The country is of 18 provinces. And then we are making the combining the data, and I'll just see. And then based on that one, we get trying to get the response out. So this is the what we are planning. Right now, we have just like integrated between DHIS2 and the EWON in a semi-automatic way, where we push the data to EWON system, and EWON system gives the output, and then we put the EWON's data back into DHIS2. But we want to try to make this one automatic so that like it can be used not only by the higher level, but at least at the province level people and district level people. So this is just an example of combining the diarrhea data in one of the place in Udumsai with the rainfall and temperature. So over the last few years. Same thing with the rainfall and things with the dengue. And this was the like one of the things, like this is not the district, but like the EWON system causes it's a district, but like these are all the provinces. In Lao, we have 18 provinces. So all the different things, and then these were all the different accuracy, and based on the things what they've been trying to predict, the positive predictive value and negative predictive value. And based on that one, they've been trying to do. Same thing for EWON for all the things. You just see like we didn't have some of the data, we are missing for some of the provinces. So again, so these are the few of the things output what we've been trying to produce. So how this will help? If we know the outbreak based on the climate, we can try to prepare a bit more better, or as I say, much more better. With like the diarrhea outbreak and all the things, so we can have the ORS stocks and all the things in a particular area, prepare the health worker, which they already know that there will be, because it's they know that okay, the climate change is happening, but like we know there will be diarrhea things, but we don't have sufficient drugs or the equipment or the things, so they can try to deal with that one. And also educate people when they go out, like okay, you have to drink more water, all these things. And so that can be the few of the other place. The second topic, which I'm going to talk very quickly, is about what all the different things, what we did to integrate between civil registration system and DHIS2. DHIS2 started long time. Civil registration system, which is, or we call eCRVS, they used a software called HERA, which they just started last year, end of last year and this year, to do all the registration and everything. But the Ministry of Health had all the other data. Ministry of Health did a survey, hospital survey by all the health worker, which is called the Family Health Information System, where we collected all the family members' details, family details, household details like water and sanitation, and we try to compare all the things. And we also just see, these are all collected in DHIS2, by the way. So we had 6.3 million population data in DHIS2. The total population of Lao is 6.8. So we had 92% of the coverage in Family Health Information System itself. This is the survey usually was done every year, but during the COVID, the Ministry of Health didn't do that one because like we had to be locked down. But COVID also helped us because like DHIS2 system was used for building the COVID certificate, and that also helped to collect 6.2 million record, and 30% of the record has been verified by the public itself. And rest all the things because of the COVID certificate and COVID vaccination ID. So 6.2 million people have the unique COVID certificate ID, which can be used across different places. So we have all this data now. And then civil registration just started and they had 100,000 data. And I say how best we can try to collaborate. So what we just say, okay, look, we have all the data, we can give it to you. You can verify with your own stream and all the things. And then you can provide the national law ID, which then we will be imported into DHIS2. And once we import, people cannot change the ID, the name, the first name, last name, date of birth, and the sex and other few details. So those are part of the civil registration system. What we will try to do on the birth notification is whenever the birth's happening in DHIS2, it's been recorded, we just send, these are all the information, what we'll send it to them. And they will verify and all the things, and they will send back the things. This is something which is very essential. So Ministry of Health and Ministry of Home Affairs, who's dealing the initiative of ECRVS, they have an agreement on like, how do we share the data? First thing is the general things. And then in the middle section, there are some, sorry, everything is in Lao. Even I don't understand Lao. But like, I can understand there is something called API in few places. So what they've been like trying to just say, like, okay, these are all the information which we will be sending to DHIS2. And these are all the information where DHIS2 can send using this API. So it is also at that particular minute level details as how the data exchange is happening. And it is being stamped and signed by the both ministry. So this will allow the technical people of Ministry of Health and Ministry of Home Affairs to work together. So they have a broad agreement. And at the level down, so then they don't have to go and ask every time, oh, can we share this data? Can we share this one? How do we share? So those are all different things has been charted down, and we put on things. Similar kind of things, we won't try to do that one in the climate things, but we still don't know how best we can try to use it, because the climate stations are in different places. With the WHO initiative, what we've been trying to do is to have few other weather station installed in the health center, so that like data exchange can happen. And like we've been working with the University of Oslo, the core team on how data can be stored and communicated across and predict things. So that's basically I want to have. So we have more time for the discussion.
Very well done, John. And everyone, can I call all the presenters up to the stage here? Jörn, Jennifer, Prosper. John, you have to go and sit. And you can prepare yourself for some questions, but I will just, while you are sitting, maybe starting with Jennifer, because we following up on John's topic of exchanging data between ministries. That's a challenge, I assume. So could you share some of your, I mean, you have the Ministry of Agriculture, Health. How is that? Has that been a challenge in Malawi?
Thank you very much for the question. Yes, for us, it's also a challenge in terms of data sharing. When it comes to raw data, it has been a challenge. But what we do is that when maybe we are developing reports, we do invite the stakeholders that we have to work with, informing them what is required. So maybe that can act like an MOU between the two ministries. So once the authorizing authority from that ministry authorizes that they can be able to provide that information, we're able to get that information. Yeah, and but most of the times we do work together in different forums. For example, to do with the nutrition aspect, our ministry, we have a department of extension. We have a section that deals with nutrition intervention in the agriculture sector, but they do work in hand with the Department of Nutrition in the Ministry of Health. So in terms of collaboration and maybe access of information, when we are working in that environment or forum, it doesn't create that kind of challenge. But maybe if there is that not collaboration, that's when there is more challenge. Yeah, thank you.
Thank you. And we have heard now, you know, going from the whole national development plan all the way down to community and to the extension workers. It's kind of a big span of scope. So, Jörn, do you want to comment?
It's not so much tested out on the sharing between animal health and human health in DRC, but nobody has so far opposed to the idea of a shared dashboard where people are sending data from the one system, HMIs, and the new system into the same dashboard. So it's not so far an issue as far as Adam can, of course, add to that. But more important is to in that case with say the agriculture, I mean the Ministry of Agriculture, Fishery, and all that, and the Ministry of Health is to start working together and to work together on the data. And that's not yet there. And in order for a kind of integrated zoonotic system to surveillance system to be realized, that is, of course, important. But also it's important that the animal health side and learn a bit from what has been achieved in human health in order to develop the systems at these peripheral levels and out in the districts and in the province.
You guys can also ask questions, so prepare yourself. There is one there, but I just want to say one question I have. The incentives for the farmers to do animal health is not really there because they are, they want to, bring the livestock up. But of course, if a animal dies, it's, it's an economy. So I think the institutional practices are super different from the animal side than the human health side. So that, I guess, will be a huge challenge, even though it's impacting a lot and more. I saw a hand. Mahmoud is a runner, actually.
Thank you. Thank you for the presentations. For Malawi, it was really impressive to see that you have 379 weather stations. And I was curious as far as, I guess, just lessons learned, experiences and how you find, I guess, maintenance and the quality coming from those weather stations. And potentially also maybe from Lao with, you recognize this as different, you have 6 and you have 18 provinces. If you're looking also peaked by this number, or if you're looking at Google Earth Engine, or I guess what you feel like next steps might be for you. Thank you.
Okay, thank you. So in terms of maintenance and data quality, so for us, the system in terms of data quality checks is that once the extension workers collect any data at community level, the one who is heading them, or the coordinator, we are calling it at EPA level, that's extension planning area, the ones who coordinate agricultural activity, is the one who is responsible in terms of data validation. So we go through stages of data validation before it's utilized by the ministry or even accessed by the Department of Meteorological Services. So in terms of the weather stations, the way they are is that some of the weather stations, they're automated. So the Department of Met, they are the ones that receive directly the weather information directly from the automated stations. But some of the stations, they're not automated, so they have to wait for the extension workers to collect that information and be able to share with the Department of Meteorological Services. Yeah, thank you.
Just on the Lao side, like it's we looked at the Google Earth Engine and tried to get the weather data, but Lao does not really have so much there. So like we even looked at because it takes the average things, right? And it takes from the different points of the weather data, and then it's not so accurate. So that has been one of the challenge. So what the WHO and the Ministry of Health are trying to do is to buy few weather station data and install it in different places. And we looked at a few of the devices. It's not so expensive, and it can directly send the data to the server, and we can get both the rainfall data and the climate data into the system. And then like we can just see how best we can try to use it, utilize it. That's what we've been trying to focus on.
So average is not a good thing when it's come to climate data, actually. Temperature is the peaks, down and up. Arm?
Thank you for the presentation. Just for the for Malawi and Kenya and DRC, I think it will be very good to learn more about how the use of the data at the community and the community level. But my also particular interest is for the Lao presentations on the CRVS side. So we are pushing the data into the CRVS, but what would be the use of the CRVS data back into the health, the data as part of the analytics and the products of the system?
Thanks, and so just to address on the law first, and then I can give the mic to Jon to answer on the zoonotic one. With the CRVS, what we just told that, like from the Ministry of Health side, all the births and all the deaths, whatever it is collected in DHIS2, we will send the notification to them. We are just sending only the notification with given the ID numbers and all different things. And what the Ministry of Home Affairs with the HERA system will give is all the deaths happen in the villages. So that will be pushed into DHIS2. So we are giving the notification, they will confirm it and then give the national ID on the death side. So whatever deaths happen in the hospital, we are going to share with them. And whatever the village death happen, we will share it back. But the challenge is in DHIS2, our org unit is the facility, the hospital and all things. In the CRVS, it's only districts and villages. So when these are the different things, the challenge which we need to try to take care. But in Lao instance, villages is also part of Lao DHIS2 org unit. So it was easier to transfer the data between eCRVS and DHIS2.
Lessons from the human part of the information system, HMIS, is of course that you need to feed the information back and get interest around the information at as local level as possible in order to move forward. And I think that is one of the lessons from the general human information system that we need to give to the animal health side, that even though it's not necessarily achieved everywhere in HMIS, etc., but if you're not being able to give data that are interesting for farmers, for example, when it comes to animal health, then it will be no progress anywhere. And that is also the reason why we are saying that we need to include other indicators, not only the zoonotic diseases, because the farmers may be more interested in diseases that are affecting their economy and livestock and that kind of things, than necessarily that kind of speciality of transmission between animals and humans. So to strengthen the more generally the information system in animals is probably the best way forward to also get the early warning and health security surveillance that we are interested in from the other side. And so give data back to the people is important, and the data that they want or need.
We have a quite big spam from animal health to monitoring the SDGs across sector, I would say. But however, cross sector. So Prosper, you were presenting both from the National Development Plan, but also down to the Rwanda, even though that's Andrew's topic and Adolf and team. Have you seen any of the incentives to actually utilizing the data on a different level than the national, at the national? How low can you go with those data?
Yeah, thank you very much. I think in all the implementations we've seen, the most incentive that most of these most of these implementations go with funding. So they are resources attached to the innovation. The implementation that are happening at both national level district level and then village level. So you will find a lot of need to report. I think the reporting, we had one question which was about, how do we get these sectors to all report? So one of the incentives that as you report your data, you are getting more funding. So it's like results almost based financing. But also there is also a competition that is among this, because there's a lot of comparison between one village to another village as you are doing your reporting. So this data is available at different levels. We've seen in Rwanda, it used to be on boards where people go and read, but now you have it on the dashboard, or you can even have it on the phone. So the more incentive is the team being able to see that they are being counted, and also the reporting comes with more funding as you are implementing.
Thank you. Any question from the audience to this distinguished panel? Oh, Busoya, you can.
Kristen almost asked my question, but this is to Prosper on Uganda specifically. I can imagine that the level of integration you've achieved in Uganda is actually quite impressive and very expensive. Do you think Uganda is at a place where this is now institutionalized, where if the European Union doesn't fund it, there is enough value that's been seen? I mean, the president has a dashboard that the government will continue to fund this because they see the importance and how critical this data is for the economy.
Yeah, thank you very much. That's one of the, the big thing that we look out into implementation, especially in the governments, really looking at sustainability, not only just having a good use case that can be able to, showcase in a conference or whatever, but people really using this system. So the beauty around Uganda implementation is that the system has been in place. Whether it has been, it's been more of Excel spreadsheets. So people have been reporting with, Excel, and the office of the Prime Minister go through all these Excels to look at the different sectors and they generate a report. But the biggest incentives is for them being able to, as first from the office of the Prime Minister, which is managing this, being able to manage data very well, having a robust system that can be able to give them longitudinal data. But also for the other sectors, also being able to have a place where they can be able to go online and look at their data. So that's one of the biggest incentives that is really pulling this. Then they have been also structures of this reporting in those ministries, different ministries. They have structures of who is reporting, when to report, and the deadlines and so on. So that structure is already there. So this platform is already finding some comfort in the implementation. Yeah, so the European, of course, Union has the contract they had with us to support this is ending this month, and that's why they have actually asked us to have an MOU where we can be able to keep supporting them as we keep moving. But we really see that they're also thinking of in the next financial year, which is beginning this year, to put a budget that will cater for the maintenance of the system. It's being hosted by the national data warehouse. So that's where it's hosted. So there's no cost to the hosting, but also the budget that they are planning in, and they've actually asked us, like what kind of implementation needs do we need, like trainings, regular trainings, and system upgrade and so on. So there is a really good, a great willingness to be able to support it moving forward. Thank you.
Thank you. Any other question from the audience? If not, I have one. I can take it more generally, but hinting at agriculture, Jennifer. We have seen in education that the appetite for having better data system for analytics are coming from ministries when they look to health that have better. Have you seen any of the same? What has been a driving force from agriculture to use DHIS2. It's not a leading question, it's not. But I'm wondering whether this kind of appetite for data has kind of spread or diffused through the pandemic or the quality or the more data, as we have seen in education. There's not jealousy, but a bit of envy and competition between health and education. Jennifer.
Yes, so for us in the ministry, I think before the start of the NAMI system, there always has been interest in agricultural data by different stakeholders that we work with. But I think the challenges that we were having then was that in terms of having timely data, having a database where the information is consolidated. So with the introduction of the system in the sector, it has gained interest with the donors and gained interest with academia, the research institutions, the students that use agriculture information for different reports and also generating different policies. And also there is an interest whereby now we want to be using further the household registration for different interventions, maybe also including the subsidy program that we implement in the ministry. So yeah, for this system, I think it will provide whereby easy accessibility of information before, rather than that before when it was a challenge for one to have access to agriculture data. Yeah, thank you.
Yeah, we have one question online. So the question is for all of you. In any of the countries we are using DHIS2 for cross-sector, do you have any data sharing policy? That's a question.
Yeah, like it's on the Lao side, like we have between the ministry, Minister of Home Affairs. Hello, can you hear me? So in Lao, like we have the things with the Ministry of Home Affairs and Ministry of Health. So there, like we have a clear-cut data sharing agreement, what data can be pushed, and also what are all the different fields that Ministry of Home Affairs is collecting for the births and the deaths, and what are the different fields which DHIS2 is collecting. So they are also including few of the data which they want Ministry of Health to collect so that they can try to do. So it's not only agreement on the data sharing, but also on the metadata side and all. So that's it's been there between two ministries. With the Ministry of Natural Resources and the Environment, we are just starting. So where we are pulling the data from there, but I'm not quite sure what data we will give back to them. So right now we are just like only pulling the data of the climate and the things from these weather stations, but not much what we can are giving back to them. That's from Lao side.
In Kenya, there is an agreement between Ministry of Health and the climate meteorological agency, whatever that is called, on sharing of climate data and health data. That is something when we had a meeting in the Ministry of Health in Kenya, we were informed about, and they are actually launching initiatives around climate and health, and we will have a big conference later in the year. So they focus on that sharing.
We're just commenting before you, Jennifer. So World Meteorological Organization are advocating for open data. So that's kind of in the era of sharing, but in practice, of course, different. Jennifer.
Yes, for us, Malawi also have a data sharing policy that is being managed by the Department of E-Government under the Ministry of Information. So as the government entities, we are able to utilize that policy. And also we have the National Statistical Office. They are the ones also who coordinates and oversee all the data statistics that are collected in the government sectors. Yeah, so we have that policy. Thank you.
I will put my commissioner from Ministry of Education of Health from Uganda on the spot to help me with this. But I for in terms of data sharing, but I know Uganda has had an initiative, so maybe I'll ask Dr. Sarah to comment a little bit on data sharing across sectors.
Thank you very much, Prosper. I think data sharing across sectors in Uganda is something that is being promoted, especially under the current National Development Plan framework that Prosper presented. And this is to align all sectors towards ensuring that we achieve the Vision 2040 or the development plan goals. And we are using the program-based approach to planning and also to performance monitoring. So we all have indicators, and this is to enable sectors to move from being implementing as silos, but like, for example, the Human Capital Development Program is comprised of 3 sectors: health, education, and gender and social development. So on a quarterly basis, we actually have to show cause on how the Human Capital Development Program has contributed to the achievement of the National Development Goals. So we have an M&E framework where we have to look at all these indicators and see the performance. So we must know how education is performing, gender and social development, and health, and we are assessed as a program towards this achievement. And this is done through the Office of the Prime Minister as the overseer of government. So I think that is the sharing. Then instead of having one sector information system, we are now opening up to see how we all contribute to the goals. Thank you.
Thank you very much.
Thank you very much. Just a short question to Malawi. I'm from Pakistan. Do you have any plan to actually study the impact of the weather on the incidence of the diseases in future? The impact of the weather on incidence of different diseases in your areas.
Have we started? Sorry. Okay, yes. Yeah, we have plans on how we can assess the impact of climate on different diseases, including the animal diseases. That's why we are saying that we have started with the climate information, and also we are also looking, we also have a module on the animal health. And in the future, what we want to do is to link these 2 modules and be able to assess on how one module, one data contributes to the other data set. For example, how climate is affecting or impacting disease outbreak on livestock. Yeah, so that's where we are going. Yeah.
Thank you. That is the last word from this distinguished panel. Thank you so much. A big hand. And we have a coffee break, but please come back sharp, because we have then a very, very exciting plenary again with looking forward for DHIS2 to become an innovative platform. And we will have presentation by Lars, Austin, and again, a distinguished panel. Okay? See you all. I think the best way, what we have learned through this week, the best way to start a session is to start a session. Then people will come eventually. So this, since we have so many fun parts of this session that will last 1.5 hours, we need to start, because we first will have Lars and Austin reflecting on 20 years or more. But DHIS2 is not 20 years. Well, it's very soon 20 years with DHIS2 from 2005, actually. 18 years of DHIS2, and looking forward, looking how DHIS2 can become even more an innovative platform. Yeah. We will also have Mark the CEO from PEPFAR. We will have Andrew Mahir from Ministry of Health of Rwanda and his Rwanda. And we also have Pamud Pamis Shrilanka in the panel afterwards for discussion. So over to Lars and us.
All right. Thank you very much, Kristen. So let me just start by saying it's been really tremendous to watch all the beautiful presentations that we've seen this week. It's just really amazing to see all the use cases and the domains and all the different fantastic work that's being done. So when you look back in time, you actually start to realize it's been a while. Like we've been doing DHIS2 now actually for 17 years. And time flies, as we can say. So today, Austin McGee and myself, I'm Lars, have the honor of taking the opportunity to kind of look back a little bit on the history and reflect a little bit about what has happened and also about some of the lessons that we learned over the years. And then after that, Austin is going to talk about the future. We're going to look at what's next for DHIS2. We have a lot of exciting new solutions and new ideas coming up. So stay tuned for that. So to begin with, I'm going to have the very difficult task of explaining the history of DHIS2 in 5 minutes. Probably cannot be done, but let me try. So, and one of the key messages here is that it hasn't really been the way it is now all the time. You know, this is pretty new. The way things are now with product managers and solution architects and Jira and CI pipelines and things, it didn't really used to be like that in the beginning. So the very first implementation of DHIS2 actually took place in Kerala, in some Indian states, back in 2006. And it was done by HISP India. And the systems were very much standalone. This was before we had even internet in India. So everything was offline. So the system was basically then written on a CD, a rewritable CD, and then shipped by motorbike to all the health facilities. So people were driving around and installing CDs in the health offices. We even had rewritable CDs, I can remember, because every time there was a bug, you had to write a new CD, and then you had to go and install it. So I think it's safe to say that the whole thing was a lot more laborious now back then than what it is now. This was also the first developer workshop that we had, and the core team, the core team is actually what you see on that photo. I don't know if you can recognize some of these people. We have Abhiyat on the left. He's been a fantastic person for DHIS2 over the years. Been there from the beginning. We have Bharat, who was the lead developer of HISP India at the time, and then some other guy on the side. You don't know who he is. Too much, can't even recognize him. And on the left there, we have the one and only John Lewis. I don't know if you count as developer John, but John has been very instrumental. Also, John told me to say that bottle on the photo has nothing to do with John. That was not him. All right, so from India, we moved to Sierra Leone. So Sierra Leone was really the first African country where we implemented DHIS2. Once again, it was standalone, so deployed on district servers. And at the time, there wasn't any kind of fancy, web apps and dashboards and visualizations and these things. We only had data entry. We could create data elements in Organets and look at dataset reports. That was it. Maybe download the PDF. That's what you could do at the time. So we had trainings. There was less to train on. We had, as you can see here, like data entry screen. That was it looks very much the same as it does now, even the data entry module, I will say, but everything else has changed. And once again, like the data was really then, sent offline. So we had to basically then drive around to every district by car, by a Land Cruiser. And then you had to drive to a district. You made an export in XML, and then took it onto your own laptop. You upgraded the WAR file. You got some feedback from the users. You did some training, and then you started driving again to the next district. So needless to say, I was quite laborious, and data timeliness suffered a bit from all the driving. And of course, in recent times, Sierra Leone also has now decent mobile internet coverage, so things have improved. Then we moved to Kenya. So Kenya was really the first large-scale web-based implementation of DHIS2. So this was the first national-scale DHIS2, I would say. And I would actually say that the timing was on our side. During those years, the mobile internet really took off in East Africa. So you know, Jörn and I and Ula, who's just coming here, we traveled around in the districts in Kenya, and we saw that, you know, people were entering data. When the Wi-Fi went down, people just picked up their dongle from their pockets, put it in their laptop, you know, and continued working as if nothing happened. And we were just amazed, and we thought that this is very good for us. This is a good timing. So we managed to actually then customize and roll out DHIS2 in Kenya fairly quickly for aggregate data. And within something like 6 months, you know, people could actually then just enter data and look at reports. I will say that in the during those years, like we had nothing like we have now in terms of CI pipelines and, you know, Q&A teams and beta testing and whatnot. We usually joke that we talk to the end users in the morning, we develop features in the evening and at night, and then we push to production at midnight. And then you made our silent prayer that things would work in the morning. So yes, very agile at the time, maybe a little bit too much. And then, you know, Uganda took on DHIS2 and Rwanda and Burundi and all these countries, Ghana and South Africa, and the ball started rolling essentially. And a lot of countries in Africa and Asia started to use it. So going to leapfrog a little bit. Then in 2013, we got interest from a huge organization called PEPFAR that looked at DHIS2, and we also have Mark DeSalle here today with us. He has done a fantastic job stewarding the information systems of PEPFAR. And PEPFAR took interest in DHIS2, I will say, because it was used in so many countries, right? So many countries used it, and they thought, it might work for us. So we had a couple of years where, you know, there was a lot of work day and night to adapt DHIS2 for PEPFAR. We called it DATIM for PEPFAR. A lot of aspiration and a lot of perspiration, as Mark likes to say. And I think today PEPFAR is used by something like 35-ish countries, something like that. Yeah. So that was a huge. We even had like trainings in Johannesburg. The apps weren't made ready. We developed apps at night and demoed in the morning. It was very stressful. All right. So around 2014, this is when DHIS2 really started to become what I would call a global standard, right? So we had lots of people like traveling to Geneva, and Kristen and Ula, and Knut was even seconded. We even like gave Knut to WHO for a while. He worked there. And that ended up with a official like collaborative center agreement with the WHO. We had many people, I think Ula, Prosper, and others traveled to Atlanta to meet with the CDC. We worked a lot with CDC on the global health security agenda. Other organizations, even Google showed interest, sent us an invitation for their Earth Engine workshop. And Björn made this amazing presentation yesterday, or was it the day before, where he showed all the cool stuff we can do with the Google Earth Engine even today. So that has been really a fantastic collaboration. And then we had the DHIS2 Symposium in DC in 2014 that really kind of exposed DHIS2 to the NGO community. And then NGOs started to become aware of it. And then the ball started rolling also on the US side. UNICEF also started using, adopting DHIS2. All right, and since then, I would say the rest is history. As we've seen this week, there's so much going on. I think you guys know much more than I do about what's going on these days. Too much to cover, and the rest is history. So with all this history, I think it's time to kind of reflect a little bit on the lessons learned. Like, what have we learned from all these years? And I'm going to focus mostly on the software design now. I'm a software engineer, so I'm going to focus a bit on the software design here. So obviously, like generic design, accessibility in apps has really been critical for us. So we like to talk about like generic design as a success factor. So when we went to Kenya in East Africa, we quickly learned that a lot of the countries in East Africa, they had the same challenges. We went to Kenya, solved a lot of problems, went to Uganda, faced a lot of the same problems, went to Rwanda, same problems. And we saw that there was a lot of potential for reusing the same software. Right? You should not go back to scratch and build new software for every country. That would be very dumb. So we decided that we should try to make it very flexible, generic, reusable, so they can build on what's there and take it forward like that. The good thing with being generic is that it really reduces maintenance costs. I think today it would have been totally impossible to support software for every country, right? From the core team side, that would have been unmanageable. So we decided to make a generic core software that could be used. The other thing with generic software, I will say, which may be a bit underappreciated, is that it really accumulates best practices, knowledge, and solutions. So when you go to one country, you work through a set of problems, and you sort of solve the problems. You have, long nights. You work hard. You figure it out. When you go to the next country, that problem is more or less solved, right? And then you solve another problem in that country. You move to the next one, and in that journey, you really kind of accumulate knowledge and solutions, so that the kind of the solutions are transferred country by country. And today, I would say, when countries today start to adopt DHIS2 for especially for aggregate and events, it's fairly easy, right? They can get up and running quickly and start using the software because a lot of the problems and the challenges are kind of already solved. There's of course still problems, but the foundational ones are solved. And I would say generic design, of course, has the context dimension, where you can use it across countries, across domains, across use cases. You can also then think of generic design in a time dimension. So as you know, everything tends to change over time. There will be new data sets, there will be new programs, there will, forms will change, new requirements. You go from aggregate to individual. The good thing with being very flexible and configurable is that you can do all of this without having to go back to the dev team and ask for changes in the software. You can do it yourself with configuration. And I think that has really been a critical success factor, that even as time goes by, you can still do a lot. Yes, of course, there's new features to be built, but you can change the system fundamentally. Super quick history. I'm going to be brief here now. Super quick history of the design. So I will say that back in 2010, we started to have this generic thinking, but there was no API. There was no custom apps, no app platform. There was no way of, the only way to get the data out, you had to download to Excel. So click on Excel and do whatever you wanted with it from there, which made it very hard to extend with features and hard to kind of integrate and extend for local customization. So the only way to do this was to basically fork the entire thing. So you took the entire software, made a copy of it, and made some changes. And even in India, I remember that they had almost one DHIS2 for every state, which, needless to say, got very hard to maintain. So we thought that we had a legendary discussion in Zanzibar, I think Ula and I, smoking some water pipe or whatever it was at the time. Nothing else. And we started thinking that we really need something that could expose DHIS2 to the world, right? So it's not like a product, it becomes something that people can build upon, right? So we decided to build an API. And in hindsight, I mean, this looks obvious, but APIs weren't really hot at the time. This is 13 years ago, or 11 years ago. So it was slightly novel at the time. Sounds obvious now. And then we had, Morten joined us. We had, very good developers joining us, building up the team. We made the API more comprehensive, and we started around 2016 to see more web apps being developed. So people now started to make, custom apps, which was great. Only thing was, it was very complicated at the time, time-consuming. They're still fairly low quality, no consistency. Everyone basically picked their own framework. So whatever framework people preferred, they would pick. And the result was that the apps looked very, very not uniform, right? It was very different, no common look and feel. It looks kind of amateurish. So we decided, or Austin came and joined us in around 2019. And I think his first reaction was, "Oh my God, what's going on? What are you guys doing? We need some consistency here." So he came up with this idea of the app platform. So the app platform is really the platform for building web apps. It brings some structure, some rigidness, and a common way of building apps, same framework, same style. So with this, the apps are now slightly starting to become more uniform. The quality goes up and cost goes down, because now people don't have to spend 2 weeks just figuring out how on earth am I going to approach this. It's kind of given. So that helps. And we see from around 2019, we see that most complex implementations now do custom apps. For every major country, there's now starting to become apps. So the thing is that even though now apps, I would say, is a huge success overall, it can be better, right? Can be better. I think it's still complex, still a bit costly to build and maintain, still break. So what we're working on now is really to create a shared and reusable UI component library, so that instead of having to reinvent the origin tree for the 100th time, you can basically then take the origin tree that we built and use that one to avoid kind of reinventing the wheel. We also would like it very easy and cheap to build apps. So it just shouldn't cost a lot of money and take months or years. It should be quick. So we now would like to make it very fast so you can build custom apps that can even be thrown away when you don't want to use it anymore. The other thing we're working hard on is to allow for custom backend microservices, right? This is to support what they call data-intensive workloads. There's a saying that when you have a hammer, every problem looks like a nail. And I will say, without mentioning any names or anything, like that is true for web app developers, because if you are a web app developer, you think that everything should be a web app. And the result of that is that people build data-intensive applications as web apps, and they shouldn't really be. They build integration jobs as web apps, and they shouldn't really be. So what we're trying to do now is really to support what we call custom backend microservices, where people can build like apps on the backend, things that belong on the backend, like integration, data processing, and computation that should sit on the backend. So that is coming, as I like to say. Okay, super quick on the methodology. So software methodology. And if you've been around in IT for some time, you know that many people are very dogmatic. They will tell you that, you need 3-year plans. All code should be tested. You should never break an API. Quarterly releases is the best. The people are very kind of opinionated about this. But I would say that in our opinion on the DHIS2 side is that software methodology is more of a strategic choice. You should really think of it as a strategic choice. And it definitely relates to the face of the platform, and it has trade-offs. So the trade-off is always between like long-term planning versus being very responsive. It's hard to be both, right? It's hard to have a 5-year plan and react very quickly when someone comes to you. Having very long release cycles versus having short iterations. There's benefits and downsides with both. Testing and Q&A versus features, like how much time do you spend on features? How much time do you spend on testing? And also how much do you focus on stability versus focusing on rapid change? Those are trade-offs to be made. You can't really have both sides here. So that's why we should think about this from a strategic side. So I would say that for DHIS2, we really had more or less 3 phases. We had the startup phase from the very beginning until like 2013-ish, where we were kind of in startup mode. Some people say we still are, but that's. So in the beginning, we really like focused on building the right solution, right? We didn't really spend a lot of time on testing and Q&A. We really focused on building like the right solution. We focused on like rapid prototyping, generating knowledge about what people need and what people want. That was the key focus at the time. And really like when you're starting out with something, and this I would say goes for any product, if you're building something else, it's really about understanding what the users need and want. That's the top priority when you're starting out. Don't spend a ton of time writing tests and pipelines and things, because if you have no users, it doesn't matter if your software doesn't have any bugs, because nobody's going to use it. You're going to run out of money and your project is going to go away. So that's why you need to focus on building knowledge about what people want. And you do that with prototyping. Next phase, around 2013-ish, this is what we call the growth phase. So this is when we went slightly out of startup mode and now starting to kind of grow the software. And the idea now was really to make the platform useful for many, right? So at this phase, you really would like to make it useful for many and scalable. It doesn't really matter if you have a beautiful system, if it's used by 5 people, like nobody's going to care. It can be the best system in the world. So now you need to focus on scale, like make it scalable, make it possible to run at the country level, and make it possible to run even at the global level. So in this phase, it's really important that you still need to accept breaking changes. I remember that we had a lot of complaints. People came and said, you guys, you're terrible. Like you break the API, you're breaking our apps and integrations. And we said, sorry, but we actually had to make a data model change because we learned that it's the right thing to do. So instead of then saying, okay, everything's going to be stable, you need to actually allow for some change and even upset some people. You just have to live with it. I know from experience, it can be hard. And then the last phase, which I think we're in now, which is what they call global adoption. This is now when people are starting to say, that this is the biggest, most implemented system in the world and all that. Then you can say that, okay, we reached global level now. And this is where you would like to slow down. You need to slow down, focus on stability, focus on testing. Now you can't do radical changes anymore. You can't do crazy things. You need to slow down and slowly start to focus on testing, slower release cycles, more Q&A, more focus on pipelines and CI, stability testing, beta testing. And I still thank the guy upstairs that we had Phil join us around 2018, 19. Phil is our Q&A manager, has really brought a lot of rigor and testing and quality assurance to the team. So we're very happy for that. Okay, we can skip ahead a little bit. So let's talk a little bit about the software strategy for DHIS2. So with DHIS2, we try to really have a deliberate strategy from the very beginning. And I would say that a foundational piece of the strategy really was to have a strong core developer team, right? So the good thing with having a strong core developer team is that you can really have an overall vision and holistic plan for the software. It allows you to build the product that you would like to build. You can have a holistic, cohesive plan. We know of other systems in this space that rely more on community contributions, that people in different countries and teams and so on submit patches. We think that that is problematic because it then really leaves it up to the community to decide what's going to happen. And it's very hard when you sit in one country to understand what to do from a global perspective. We know that's very hard. It's very hard to have a global perspective when you sit in one particular country or organization. So we believe that having a strong core team is really critical for having a software that's cohesive and have a holistic vision behind it. At the same time, as we talked about many times, we would like to make it very configurable and generic. So by making the system configurable, generic, and kind of adaptable, we allow implementers to really configure it to the needs. There's no need to go back to the dev team to kind of ask for something all the time. You're not stuck, not being able to do what you want. By having a really flexible system, you allow the implementers, like the non-technical or semi-technical implementers, to basically adapt the system. And of course, designing the software with extensibility in mind. That's been absolutely critical for us. So what that means is that you can now allow the system to be integrated with others. You can build scripts, as Prosper talked about in the morning. You can have scripts, integrations, widgets, plugins, name it whatever you want, custom web apps, to go the last mile, to kind of cover the last mile in the country. It's very hard to make a generic software that supports the whole world, right? You do have to allow local teams to customize, to go the last mile, and make it really work in the context. And to do that, you always have to do some local work. So that's what we're trying to do deliberately in the whole architecture of the software. And of course, we have seen this week that even from Oslo, we're trying to really support a capable community of local developers. So having the combination of a strong core team with a very capable set of like local teams in countries is a very powerful combination. We've seen so much innovation, Tanzania and South Africa and Ghana, I'm probably forgetting many now, have shown us like really amazing stuff this week. Local apps, innovations, integrations and whatnot. So it's clear now that this approach is working. Like we can see so much good things coming out of the country. So I really impressed with all the stuff going on now in the countries. So how does this translate then to the architecture? So all this strategy, we're trying to inform the architecture, right? So what you're looking at here is really like a very high level overview of the architecture of DHIS2. A bit simplified, of course, but from a high level. So what you see in the blue part there is really the core platform. This is the backend core DHIS2 platform. That's stores the data and has all the business logic, etc. The white areas there are what enables this extensibility and integration. So we have APIs, we have the app platform, we have webhooks, we also have other things that are really the enablers of extensibility and local customization. So these are the things that allow you to kind of plug in and extend. Of course, we also have core web apps. So there will be core applications like the data entry and the maintenance and the data visualizer and all these things that you know well. We do believe that it's very important to have a strong set of core web apps, at the same time allowing for local web apps to be built in the context. So then around this core architecture, we then see that we can have local apps and local integrations so that local teams in countries are able to build their own web applications, their own Android applications. The Android app has come a fantastic long way now. We can see thanks to Marta and Jose and the team, really a fantastic job. It now has an SDK. You can build your own apps on top of the SDK. You can plug in new domains, new modules and whatnot these days. It's become very sophisticated. And it really also enables people to build their own Android applications. Same with integrations. People can now build their own integrations. We've seen numerous examples this week of people integrating systems now. It's happening everywhere. So people are using the APIs, the webhooks, and so on to integrate with other systems. And this is, we like to say, this is by design. This is what we try to do from the beginning, to build a core platform that's possible to extend and build out in the local communities. Okay, so a couple of other points on how we think about software. First of all, facilitate the entire data flow. What this means is that DHIS2 allows you to capture data, import data, manage the data, and also analyze and visualize the data all in one thing. Some people call it a boom box, it can do everything. I think we also seen this week that we now see more and more like data lakes, data warehouses, data integration systems being used, which is very cool to see, and it's happening now these days. But for many countries, at least going back some years, I think setting up this kind of data lake architecture with data pipelines and joining of data sets and that stuff, it's quite complicated. It's not trivial, right? And many people struggle, even all over the world, many people struggle with that. So allowing people to do the whole life cycle of data in one platform has really been helpful for us. Data entry, import, validation, analytics in the same place. Now we see that it's becoming more of a kind of more broader architecture, but that's just very, very interesting to see. Open source license, of course, has been critical. I have to be honest, we don't get a ton of contributions. It's not like it's coming in lots of patches and so on. That's not really been the major benefit. I would say the main benefit of open source is that it reduces risk of project financing. We know that many projects are time bound, of course. So with DHIS2, even if you're running low on funding for a while, you can still keep the lights on, right? You can still keep the lights on because the software itself doesn't cost anything. Hosting costs, etc., but the software itself doesn't cost anything. So it also then removes the procurement and licensing process. If you're going with the proprietary software, one, you have to pay for it, but B, you also have to have a process, right? You have to procure it. There's got to be contracting. You got to acquire licenses. You got to install licenses. It's just so much more inconvenient to do. With DHIS2, you just download and install and you run. And that's really been helpful for us to make it simple to operate. Scalability, of course, is important. We always try to think scalability first, right? Many systems tend to do like low-level individual data. They work very well in a couple of districts, but they don't work so well in a country, right? So if you try to use a system that's developed for a few districts, it typically doesn't work so well at the national scale. But so we try to make it work at the national scale and even at the global scale. So you can take the software, run it in Bangladesh, or you can run it, PSI runs in 60 countries and so on. You're trying to think about scale before focusing on complex features. And finally, like hosting anywhere. So with DHIS2, you have a wide range of options for hosting. So it's not like it's only in the cloud or only on-prem or desktop. You can choose. So DHIS2 can be hosted on-premise in a local or government data center. It can be hosted in the cloud, in your own cloud account. And you can also sign up now for managed hosting in the cloud. There are multiple providers of manage hosting of DHIS2. So you can, if you just want to click a button, you can do that also. So this kind of breadth of hosting options also been critical. Okay, we're getting to the end. So just a couple of design principles that we have behind the DHIS2 software. There's a ton of software principles, obviously. So I'm going to just pick some of my favorite principles here. So the first one is that real user needs and input really are the foundation of product design, right? So listening to users is really the foundation for everything. I think we all agree. Like if you don't have users, if you don't listen to them, you're not really having a system. If you're sitting somewhere else in a meeting room trying to make up your requirements, it's not going to be very successful. So you need to have users, you need to listen to them. That's number one. When that's said, I also want to say, since I have people's attention, that you should tell us your problem and not your solution. This is something we see a lot. So, so people come to us and say, like, I would like, custom forms in Android, right? But then as system engineers, we always try to think, but why do you need custom forms in Android, right? And then people start to say, oh, yeah, because I would like to have these colors and I would like to have, fields in this order, and I would like to have a table of things, right? And then it's like, okay, so that is your problem, right? That is your problem. You would like to order the things differently. You would like different colors. Let's work on that. And then we can go back and design a solution that allows you to do that in a different way that might be better, right? So when you give us feedback, we sincerely appreciate the feedback, but try to tell us your problem and not your solution necessarily. And again, I just want to mention that sometimes it's quite hard to also be a core team because we get a lot of requests. People come to us and ask for many things. Now that we have apps, it's become better because people can build things themselves. But from our perspective, also, we have to be a little bit careful that if you try to please everyone, you're not really going to please anyone. Said differently, if you say yes to every request, I think the reality is that nobody's actually going to use your platform 10 years from now. We try to keep the software a little bit simple. Like we try to not overwhelm it with a million features, because if we add a million features, it's going to be too complex. And one day you're going to say, this is too complex for me, I give up. So when you talk to us and we say, man, maybe not, that is typically why we say, because in the long run, it's very good to keep the software simple. Which is the last point, start simple. We always try to start simple. So when you build new features, we always try to keep things simple. Like in the first iteration, we don't add too many things. If you add too many features, if you make it too complex, the chance is that you're making too many assumptions. You're starting to guess what people need. And when you make guesses, very often you get it wrong, right? And the risk goes up because now when you're building things that people don't really need, you have to go back and change it and people get unhappy. So that's why we try to keep it simple. All right, and that's it. Thanks for listening. I think we're going to move it over to Austin now. I just want to say Austin has taken over the lead developer role now recently. He's been doing a really tremendous job. He's doing hiring and recruiting and proposals and software and team management and whatnot. It's been really good. I think you should give Austin a good round of applause. Don't leave yet.
Thank you, Lars, but don't leave yet, because I have the great misfortune not only of following Lars on the stage here, but also as the technical lead of the project. So whoever is willing, please stand up and give Lars a huge round of applause for the last 17 years with DHIS2. Come on. Don't worry, he's not leaving yet either. We're keeping him around as much as we can.
Thank you. Thank you so much.
Thank you all.
And it's not like he's left,
Yeah.
So, he
He's just-
still continue in a capacity of advisor, and he will continue to advise us in a 20%, okay?
Yeah, Lars is handing the reins a little bit as the lead developer, technical lead over to me, which is a challenge that I am trying to do my best to step into, but I'm very appreciative of him also being on as an advisor as we continue. So coming from 3 people in Kerala, India, building DHIS2. This is a screenshot from the DHIS2 website. Great new map that was put together by Bjorn and Max's team in communications, showing all the different use cases and all the different countries where DHIS2 is used. There's more than 100. Probably this isn't even a complete list. I think there are several that are not yet in that database. Because it is free and open source software, people are using it all over the world in ways that we don't understand. We don't know. we can't know because it's somebody downloads it and uses it as the national system in their country and tells us 3 years later when something breaks.
But if you don't see yourself on the map, you can send us an email and we'll add you.
If you don't see yourself on the map, go to the website, go to the in action section, and you can look at the different categories. Share your stories also with Max. There are great impact stories from a lot of different countries on there. But we now also have a much bigger team. So from 3 people in the room, kind of writing code at night and pushing to production in the morning, or sending it on a CD on a motorbike around the country. We now have more than around 60 people on the core software team, spread all over the world. It's a remote first team, so a lot of them are watching online here today. And that's been a big change, and it also helps us to push things forward while also building in the stability and the foundation that DHIS2 provides for all of these different countries. And one of the ways that we address kind of the trade-offs that Lars put in his slides, where he mentioned that you have to choose between either slowing down releases or moving quickly and innovating quickly. You have to choose between stability and agility. And that is true, but we're kind of cheating by building this platform for extensibility. So the core and the foundation is moving into that global adoption phase, where it's the foundation for so much that all of you are working on around the world. And that needs to be stable. That needs to be rock solid. And we need to do a lot to make sure that that is has all of the core functionality for usable software, a usable platform, that it has no bugs, that it has performs well as scales go to huge numbers in many different countries. But it can also be the foundation, the platform for innovation. And that innovation is something that we do by developing different applications, but mostly it's what all of you do. And there were a large number of very high quality applications that were submitted to the app competition this year. It was a very difficult choice to choose the finalists that you'll see later today. So we want to enable that type of innovation, not only locally, but also to share those innovations and use them across different countries. So we're able to kind of cheat by building a platform that is stable, but also provides the foundation for agile development and iteration. So how are we going to do that going forward? I'm going to talk a little bit about what's coming next for DHIS2 as a platform. Extensions is something that is the next step beyond applications. So we have web applications and Android apps. We have the app platform. We have the Android SDK. But very infrequently, I think, is a web application enough, right? If you have that hammer, everything looks like a nail. You start to build integrations and you start to build data processing in web applications, which is not the right place for those to be. So it's really to enable the full spectrum of customization and adaptation of DHIS2 to different contexts, we need to build the kind of the primitives, enable those primitives to be used in those extensions and to be built. So that includes extending the API, extending the data model, having custom configuration that is shared between different countries and contexts, having applications, having plugins that let you put extensions in certain places in DHIS2 and not having to reinvent the wheel and build an entirely new application. And especially integrations also with other systems, as there's more and more heterogeneous and complex architectures in health and other domains as well. So this is where we're going. There's a lot of ways that we can support this, and we'll talk about a few of them. One of those is plugins. So we, for a long time, have had the ability to build plugins on the dashboard. We're expanding that capability, making it more secure, more performant, allowing you to bundle a plugin with an application that's already available in version 239 and 40. But there are other places where we want to enable extension points in DHIS2, enable people to extend just the part that they need to customize for their particular use case or their particular context. So that includes on the tracked entity dashboard in the Capture app, in data entry with what has been custom forms, being able to enable customization and adaptation of those forms and interfaces for a specific context. It includes Android application modules, so you can plug in, as we saw with the real-time stock module that was demonstrated in version 40, you can have modularization of the Android application and be able to replace the specific parts that you need for a particular program while still keeping the rest of the great application that's there. And many, many other examples as well. Potentially custom map layers will look at where we can add additional extensions. Another way that we're looking at approaching this is by moving to what we call a global app shell. So in the development of the application platform, we introduced the concept of an application shell. That's where the header bar became much more consistent across the platform than it was before. At one point, there was no header bar on many applications. In some cases, that's still the case. And what we're moving towards is being able to make that consistent across all of the different applications within a particular instance by furthering that separation and allowing the app shell to be updated independently and to be global across your entire instance. So this is one way that we're addressing this as well. And this also helps to provide a consistent user experience and a usable experience for the users of DHIS2 in different contexts. Another way is by introducing tracker plugins. So I mentioned this for tracked entity instance dashboard in Capture app. There are many other places where we might want to include extensions or plugins in DHIS2. And this one is plugins in the Capture app for data entry. So being able to customize how you actually enter an ICD-10 code or an ICD-11 code or other potential ways that you want to customize the experience so that someone can have basically perform their job in a better way. So this might look like having a button instead of just a drop down with an option set that then opens up a very complex custom interface for doing ICD-11 coding, for example. But there are many, many, many more examples of where this can be very valuable. So this is something that we want to add as an extension point in DHIS2 is to be able to customize how you do data entry for specific data elements in a custom form or in a form, for example. I mentioned also Android application modules. So thank you very much, Marcos, who's here for providing this slide for me. But currently there are a lot of modules within the Android application. And some of those you might want to customize for particular programs. Maybe your stock management tool, which is like RTS, the real-time stock tool, that is a little bit of a different program than a typical tracker or event program might be. And so being able to customize the look and feel and the user experience just for that one program while keeping everything else that is built into that application is really powerful. We have other examples from logistics and education, but there are many more that enable this to be useful for individual country implementations as well. And then we get to the server side. So as we mentioned, a web application hammer is not necessarily the hammer that you want to use for a lot of these solutions. And so we're looking at how we can expand the platform of DHIS2 to make it easier to build and share extensions that also occur on the server side. As Lars mentioned, the microservice server extensions. So this is enabling us also to be more agile and more modular and granular in the releases that we have, in the components that we provide, but also allows for custom integrations and custom backend services to be built and shared within the community. So now I want to talk a little bit about how we're actually going to do this or what the next releases are. This is the main bad news for the presentation. There's good news that comes right after it, so don't worry about that. Version 41. So first of all, before I dive into that, we're talking about versions here in whole numbers. So version 40 and version 41. We're moving away from the concept of having 2.40 and 2.41 because that gets a little bit redundant and gives us a little bit less flexibility. So there was actually an announcement that was published today and basically sharing that HISP and DHIS2 are just names. And they are names because we're moving into new domains outside of health. And we have functionality that's outside of just district level. There's national level, there's facility level, there's district level, there's international level. So they're just names, just like IBM and others have moved from international business machines to just being IBM. There are many other examples of this. And as part of that, DHIS2 being part of the name, DHIS2 2.40 doesn't really make sense. So we're moving to version 40 and version 41. Just a small semantic thing that we're doing. But in order to focus on a few key things, namely quality, design, and extensibility, and really make sure that the core is stable and a solid foundation for innovation and for use in countries. The next version, version 41, will be out in 1 year, so in May of 2024. But that doesn't mean we're going to be doing nothing between now and May of 2024. So these are the patch releases approximately that you will see for version 40, which was out last month in the next year. So we release a patch release or a minor release approximately every 2 to 3 months for each of the supported versions. So this is version 40 patches. And these are the other patches that will approximately, obviously the exact dates and the exact numbers might change. But this is what we're working on in the meantime, right? So we have supported versions for 38 and 39 and 40 that will be continually improved and worked on during the next year, as we're also developing version 41. And that's not all, because we have continuous release, which I talked about on Monday as well. And this is where applications can be released independently of the core. So even though version 41 won't necessarily be out for another year, we can continually improve and build even features and functionality into the applications that are built on top of that platform. So that's things like the maintenance application, the data visualizer application, dashboards. Every single web app that you can see in DHIS2 can be continually improved over the course of this year, including adding some functionality. So there might be releases of these applications throughout the year. It might be every week. If there's an issue that needs to be handled quickly, we can release it very quickly. It can be updated in different instances in a very timely manner. And if there's an issue, it can also be rolled back in those instances. So we'll be releasing continuously the applications and the extensions to DHIS2, which are becoming more and more powerful over the course of this year, which allows us to have both the stability of the long release cycle with the agility of short releases for individual applications or extensions. And if this feels overwhelming, there's a lot of releases there. We'll be also including these applications in the core releases. So you don't need to take them if you don't need those features or that functionality. You can wait for the one that's bundled with the next major release. You can also, we'll be trying to bundle up kind of an announcement of what has been released in the last 3 months, once a quarter, so that you can know these are the applications that were released. These are the minor versions that were released. And this is the major version that came out this quarter, for example. So now I'm going to talk a little bit about version 41 specifically. Who here has watched the films or read the book, Lord of the Rings? The Hobbit, J.R.R. Tolkien? Okay, there are quite a few for those of you online who can't see the audience. Who do you think is the hero of that film? There was an answer, Gollum, in the crowd. For me, the Eagles, that's a good one. So there are 2 main hobbits in the film, and one of them is Frodo, who everybody knows, and the other one is Samwise. And Samwise is the one who slight spoiler, not too much, carries Frodo across the finish line, more or less. He's the one that is stable and gets the Frodo to where he's going, which is to destroy the ring that is, yeah, anyway. Well, we won't go into that too much. This is a code name for our version 41 release. And why is that? That is because we want to be the stable hero that is the foundation for everything that we're doing. This means that we're going to focus on 3 things: quality, design, and extensibility infrastructure for the version 41 release of DHIS2. And what does this actually mean? So I'm going to share here a picture of my colleague Anna, this picture was taken in Jamaica. It's going to be a year of focusing on these things, which means there might be a few fewer features. I'll talk about a lot of the features that are exciting and coming up as well. But we're going to focus on quality, design, and extensibility so that we can provide this solid foundation. This means we'll work on stability and performance. We want to make upgrades as seamless and risk-free as possible, and we want to limit regressions that we introduce in version 41. We want to focus on design as well. So there are things in DHIS2 that are complicated sometimes. And sometimes training is a big challenge for a lot of implementations. And we can work to reduce the cost and the need for those trainings and the complexity of the software by focusing on usability, the quality of life of a user of DHIS2 so they can find what they're looking for and have an intuitive way to navigate around the platform, consistency across different applications, and things like accessibility that have not been highly prioritized in the past. And then extensibility, which, as I mentioned, is allowing the rapid iteration and the rapid adaptation of DHIS2 to local contexts. That means we need to focus on building a rock-solid platform for that extensibility that extends beyond just applications. But it wouldn't be a what's next for DHIS2 presentation if I didn't talk about some of the features of DHIS2 that are coming in 41 in the 41 timeframe. So we have a lot of releases in applications as well that might be a little bit before, a little bit after. But in this timeframe, we're going to be working on a number of things that are exciting, and some of these are part of the usability push. So some of these are focusing on making DHIS2 more usable, more accessible, more easy to understand. But some of them are functionality that is highly requested and that we've known we needed to implement for some time as well. So the first of these is a new version of the login application. So the login app is a little bit dated. I think I saw a presentation for PEPFAR maybe in one of Lars's slides where it's had this exact same login page, probably from 2014. I'm not sure if it's exactly the same, but maybe it was 2016, 2017. But it's been around for quite a while and needs a little bit of TLC. This doesn't look that different, does it? That's okay, because this means that we can build on the core that we all know, the core login application, and extend it. So have an updated, refreshed design while still keeping it familiar. But importantly, this also allows for customization in a way that hasn't been supported in the past. So this login page could also be supported out of the box for DHIS2. It's a customization using themes to be able to say, I want to put my login dialog on the left side. I want to put an image on the right side. Maybe I want to have some logos there for different supporters of this particular implementation. And this will be a theme that we can provide potentially out of the box. We're moving to a new technology that is part of also the extensibility infrastructure effort to eliminate some of the older technologies that are underlying DHIS2. So we needed to redo the login application anyway. And there are a lot of ways that people customize it today that aren't typically supported out of the box. They're very custom, kind of hacky ways to do it. So we're trying to make that more of a first-class feature. That includes having login support, like theming of the login page support, like you see here. It includes an improved way to do two-factor authentication. So you don't have to check a box and then put in a code if you don't really know what that is. That's very confusing. So if you have two-factor authentication enabled, you will log in as normal, and then you'll get, just like you see in most other applications, then you'll get a dialog asking you to enter the code from your authenticator application. And then we have the ability to do fully custom DHIS2 login application themes. So this means you can put custom images, custom links. You can do whatever you want with this while keeping the login functionality that is built into the application and can be basically injected and then themed in a fully custom way. So now for the next functionality that probably a lot of people have been waiting a long time for. This is around maintenance, and particularly the maintenance application. We're going to make it better. That's the bottom line. So I should preface all of this by saying that we're engaging in an iterative development and design process where some of these mock-ups might change. And that's actually a very good thing because it means we're talking to users, as Lars said. We're talking to people and seeing, all right, this is the idea that we have. Let's make sure that this actually makes sense for the 100 countries that are using DHIS2. Bulk edits in maintenance. That's something that has been asked for a long time. So this is a new way to view and edit and manage your metadata or your configuration in DHIS2 in a way that's been very difficult in the past. And so building in a lot of this functionality to do bulk edits, to do more intuitive and streamlined ways to edit individual objects, pagination, standardized look and feel, being able to filter, all of these types of things are part of this redesign. This is just an example of one of the data entry forms, but it'll also be much improved compared to the look and feel that's been a little bit dated for DHIS2 maintenance app. And then we have organization unit management, another functionality within the maintenance app that has been long requested. So this includes things like being able to merge organization units. It's things like bulk editing and management of organization unit trees within the maintenance application. So there's a lot that's going on there. And I did want to mention one thing that is in addition to this, that this is part of a larger effort to make it easier and more powerful ways to manage and maintain the metadata of DHIS2 systems, and particularly a network of DHIS2 systems over time. So in addition to this, we're talking about import-export stability and improvements there, and talking about ways to extend the data model to make it easier to manage permissions and bulk groups of metadata within DHIS2. So now I'm going to go through some more features quickly. We don't have a lot of time, so I'm just going to go quickly through them. One of those is cross-program line lists. So we introduced the line listing application recently, but that is only listing events and enrollments. We now will have the ability to introduce tracked entity line lists or cross-program line lists to be able to analyze and cohorts of people that are across different programs. We also have some functionality in dashboards that has been very much requested. Again, these are early mockups, but that includes being able to manage dashboards in a way that hasn't been possible before. Being able to manage these dashboards in a dedicated interface, which cleans up and makes it easier to have the data be front and center in the dashboards themselves. So hiding a lot of the management interface that you might have seen in the past and really getting it out of the way of the data that you want to present to the user. This includes things like filtering and moving those into places where you have more room to really expand on the functionality that's based there, and more features like that. A couple more that I wanted to talk about. I only have a few minutes left, but referrals and transfers in the capture application. This is something we've referred to as temporary referrals and permanent referrals in the past. But this allows you to not only make a referral out, but also to respond to that referral and say that some person was potentially seen, or a referral was processed by the receiving organization unit or the receiving facility. Android capture usability, we talked about a little bit at the beginning of the week as well. This is improvements that are ongoing and is part of our push for usability, making it easier to understand what's going on and to see the data that you need, and to really get through the application in a consistent and intuitive way. So there's a lot of improvements coming there for usability. And then this one is, it's a small one, but it's one of my favorites. This has been there for quite a while in the maintenance app subsections being available in the application menu, but it has slowly faded out of the interface. And now we're bringing it back and we're making it even better. So in addition to being able to jump to data elements overview in this example, or to go to the create a new data element screen immediately from anywhere in DHIS2, we're looking at being able to also jump directly to visualizations that you know exist in your system, to be able to search for malaria and find things related to malaria in different applications in DHIS2 without needing to know that you need to go to the data visualizer application and then file open and search in there. So this will help users to find their way around the system. And this is just the tip of the iceberg of what we can do with an interface like this in combination with the global app shell, which allows us to have this immediately available in all the different applications across DHIS2, so you have a consistent interface no matter where you are. And then my last slide is there's a lot of things under the hood that we want to work on in 41. And this is around the focus on extensibility infrastructure, on quality, and that includes a big focus on performance and a focus on security and a focus on quality. So we have testing efforts that have been overhauled in version 40 with the beta testing program. We have performance testing that we want to do, and we want to make sure that we are improving the functionality of things like program indicators and analytics runtime, and having a robust functionality for importing and exporting metadata to be able to manage metadata in a system. So look for a lot more that might not be flashy screenshots, but hopefully will be even more useful and make DHIS2 a really useful platform in all of the countries where you're working. And with that, thank you for listening, and we'll turn it over to.
Thank you, Austin. I guess there's so many that want to pose questions for Lars and Austin, but we are actually doing the panel again. And then there will be question possibilities for you. Please, Austin and Lars, please sit. And then I will call upon Mark Tesia from PEPFAR. We heard the PEPFAR story a bit today. And then I will also call up Pamut from Sri Lanka, Andrew from Ministry of Health in Rwanda, and Rwanda. And then Jörn, where are Jörn? Jörn also, but then you need to bring your rucksack down. Cannot bring that for the panel. No one will steal your computer while you're sitting there. We will take care of it. Tommy Carr will take care of it. We wanted to continue to be a bit energetic here this morning. We need one more chair. Welcome to Mark. He just arrived. You will be able to squeeze, because we have the last, would say, semester discussed heavily how we can improve the innovation capabilities, creating even a more innovative innovation ecosystem around the DHIS2. And that is actually been, of course, inspired by the, we would say, proof of the concept of DHIS2 as an innovative platform during the pandemic, where we saw that Sri Lanka was the first, even in January 2020, late January 2020, 3 days after the two suspected cases coming into the port of Colombo in Sri Lanka, they were able to make a port of entry. I just have to tell, it took the municipality of Norway or Oslo or Norway 1.5 years to do a port of entry for Gardermoen. It took 3 days in Sri Lanka. So I just want to let Pamud brag a bit about how that was possible on the platform of DHIS2 without, you know, having all the programming expertise.
Yeah. So thank you so much, Christine, for briefly introducing like what exactly happened in Sri Lanka back around like January 2020. So in summary, like what was made possible was one thing, like so within a couple of weeks of like everyone got to know like there is something really strange going on, starting from China, but like spreading really fast. We were able to produce something for COVID-19 surveillance in Sri Lanka, which is again like we as in not just his Sri Lanka, it was us and especially the Ministry of Health and many others, like especially the ICT agency, who's representing all the tech-related work and the entire governance of the country. So that is one. And the next thing I wanted to highlight is around this, I mean, like just after like 1 year's time, then we started producing COVID-19 vaccine. And that is when we were also tasked with this very difficult target of enrolling the entire population of 21 million people of Sri Lanka into DHIS2 and to track them for COVID-19 vaccination. So these were the two things that are the highlights of this entire implementation. But I would like to highlight is about what made it possible. So this is something that is also relating to my PhD work. So first thing, of course, like I will start with what Austin and Lars has been highlighting, the platform. So yesterday evening, there was one session at 5 p.m. where we kind of tried to discuss about the digital public goods and the community. And like one aspect was like now DHIS2 is present everywhere, right? Not just health, education, climate. Who is doing that? Are you guys promoting DHIS2 by just going to all the ministries? It's not really that. The true thing that actually happened in Sri Lanka and many other countries is like platform. While it is being modular, it's so customizable, right? We have many other DPGs or open source solutions where the community and I mean, like it's actually mostly talking to the developers, but here it's the implementers and the ministries. It is so easy to adopt. So that is one main thing about the platform that made it possible during the pandemic. So it was not just agile development, it was agile implementation. So we started with something very basic for port of entry monitoring. And then, of course, we had a lot of support. That's my second thing, the community and the engagement. So we had a local community in Sri Lanka, plus UIO and the entire HISP. Like we were working with everyone in the HISP and the UIO. Austin, specifically, I must mention, like he had sleepless nights supporting us to build apps based on this innovative platform. And of course, finally, the local capacity. So we had a lot of collaborations with the University of Colombo, like more than 1 decade, I would say. Like Prof. Yon can talk more about it. So we had in-country capacity. So that's why we were competent and confident to do something during the pandemic. So these three things are what made it possible.
Super. And then we can go over to Andrew maybe, because they may be the best in class of borrowing all these innovations across his groups. Can you tell a bit about your experiences?
Yeah, thank you, Christine. I think Rwanda is like Sri Lanka. So for us, what happened is that, my personal experience is that during the pandemic, people always panic, and the panicking goes around the different areas. I remember when they called me to go to the front line, I was at home. Then my family was telling me, "You're going?" I said, "Yes, I'm going." "Oh, you're going to bring COVID in back home?" I said, No, it's not bring COVID. We're going to do interventions A, B, C, D. They said, "Let's pray for you. Then close your eyes." When that time you see God, when you close your eyes. But what I want to mean is that sometimes during the pandemic, there will always be no options. I mean, no one will be knowing what to do, what will happen. Then, lucky enough, when we had a story from Sri Lanka, that's when we understood that at least there is a module, there is a package that can be implemented. So one story I want to tell you, when we are trying to find different solutions, because during COVID, there was many suggestions. One vendor came and said, "We can customize it. Then let's have a meeting tomorrow." Then all of us, we went, including our leadership, to check on the system. Then when we reached on the timeline, the person said, "It will take us 6 months. That is the minimum." Then the minister was like, "Oh, 6 months, all of us maybe will be not there." Then that option was not our option, because that's why I want just to emphasize on the flexibility of DHIS2. So imagine if you can implement a solution and it takes 6 months when it's an intervention for the outbreak. So what we did was, because after reading the story from Sri Lanka, we told our leadership, give us time, because when we are taking this innovation, we don't say we are taking them. We just say we are going to code. Then they give us like 2 days, we go somewhere. When it's just importing the package. Then we went and imported the package. 1 day, 2nd day, 3rd day, we started the system running and everyone was reporting. We were able to get the data, because it was important for us to know the cases, the confirmed cases, and be able to know which intervention. Because remember, on the pandemic, you have to ensure that one district, if it's more affected, it doesn't affect another district. So for me, I think the important thing that made Rwanda to use DHIS2 during pandemic, one is flexibility. It takes little time to implement, because at least we have a big community that are implementing and they're having innovations. And these innovations are free. They are open. That is our value. The second is that we have a global team, a network. We are not working alone. We are in countries, but we work with the country experts. But again, we have global teams that are developing the system that gives us the confidence to implement. The third is that we don't require training. Sometimes some of these modules, they are using Tracker and we already have Tracker there. Then whenever you implement it, users will get used without having the 5 or 10 days training. So without taking long, I think we'll be answering based on the questions. Thank you.
Thank you, Andrew. And this is very good examples, but as we learned from Lars, but some of us knew it before, and everyone knows it actually, our history with PEPFAR goes way back from when Mike Garron came, 8th of December 2012. And we can go into 13 then. But Mark, can you tell a bit about the travel and the journey with DHIS2 and why PEPFAR chose to go along? And we are very happy for that, I have to say. That's another story, how PEPFAR has been so instrumental for DHIS2 to become a platform, because somebody needs to finance the core and nobody wants that except for PEPFAR. Oops. So what is yours?
Thank you, Kristen. And it's a pleasure to be here, particularly in this panel with so many esteemed colleagues. PEPFAR has been investing in the DHIS2 platform, as you said, since 2012. Actually, I think some of those initial discussions started, and this predates the shift in the PEPFAR program to doing much more granular data collection, much more frequently at the facility level. And we support over 50,000 individual facilities, over 53 countries, so more than 30. And in 23 of those countries, those are bilateral. So we have a bilateral agreement in those, in almost all those countries. DHIS2 investments predated PEPFAR's engagement in those countries. And that was one of the major reasons why my predecessor, Mike Garron, chose, as we were looking at sort of reading the tea leaves about where the program was going, wanted to do more than sort of a single data point entered for a single country once or twice per year, to quarterly, getting much more granular about all aspects of the HIV epidemic, monitoring that. And so that appetite for data, we knew on the system side that you were not going to be able to engage with host governments around that level of data collection, that level of frequency, if you were to bring in some big proprietary system that really had the perception of hoovering up data from a country. So that was a strategic decision to use the systems that were known and trusted, and that there was a large community built around DHIS2 already. However, there were growing pains associated with that. And Lars mentioned, and I see Jason and Ula and lots of other folks who've been part of that journey with the PEPFAR program over the last decade plus. PEPFAR is celebrating its 20th anniversary this year. There's a big campaign, of course, with our lawmakers to advocate for a reauthorization of the program, and we're very hopeful about that. But something really remarkable is happening right now within the Department of State, where I work and where the PEPFAR program is focused. And so we are, as in about 2 weeks, we will be the Global Health Security and Diplomacy Bureau. PEPFAR has always been sort of a temporary office within the Department of State, and the PEPFAR program will be the anchor for this bureau. So we will still be executing PEPFAR, we'll still be doing that, but there will be other diseases added to that bureau. And our ambassador, Ambassador John Kingasong, who previously led Africa CDC and worked on the COVID response across the continent, will be dual-hatted, representing that bureau and the PEPFAR office. I mentioned this because it's relevant, because as the PEPFAR program has helped to advocate for more investments in DHIS2, created that appetite for data much more frequently, much more granularly, which again, we can get into some of the caveats associated with that. We have an opportunity to better coordinate the way in which different parts of the United States government are thinking about their data models, the tools they use to take those up, the capacity approaches they take for those that are collecting and managing data systems at a country level. And so we see potential over the next years to really leverage the new organization within our office and our bureau to be sharing the examples and experiences that we have within HIV data across a variety of other areas. Now, the double-sided coin with PEPFAR using data so often is that there's just this insatiable appetite for the types of data at a global level that we need. And so we're really trying to, there's a sustainability roadmap in development right now, and we have a data roadmap that will be a part of that, that'll be publicly available in the next few months as well. And we really want to start incentivizing. My boss disagreed just last week, and where I was trying to say we need to control our appetite for data, and that's not going to happen. Where we do agree is we can control our appetite for parallel data. So we really need to be doing more education showing the consequences of asking for things that don't really exist in national systems, and being and using a better awareness of what actually exists and what it takes to generate those to inform what we collect, when, and how we use that. And so part of that data roadmap is better describing the sort of archetypes, the states of national systems and investments from country to country, and helping us to understand what we can reasonably ask for and in what formats. And I'm looking at my colleagues from Global Fund who are in here as well, who are already starting to think about following PEPFAR's model for direct reporting, and really just want to encourage us and our colleagues from WHO as well, really just to be thinking really very hard about how and what we're requesting because of those consequences. I did just want to say a couple other things. As we're developing and using these systems, the need to monitor the HIV epidemic longitudinally is very real, and many countries are doing some sort of individual level systems, whether that's tracker or open MRS or something else. And also for HIV and many other programs, we need to look beyond data that may be in DHIS2. And so there's a lot of guidance that we have around our program right now around sort of integrated national data repositories, data warehouses. In some countries, they may be trying to use DHIS2 for that. Lars and I spoke earlier, but in a lot of, they're using Azure, they're using AWS, they're using something that may be on-prem, that might be hosted, might be hybrid. And we should only expect more of that. And we're driving a demand for that. But thinking about how DHIS2 feeds into that, is part of that, is absolutely important. Coming from representing the United States government, we have a lot of cybersecurity requirements. And so a lot of these investments in core have been a necessity for things that we need to be able to use this platform within the United States government system boundary. And those are only increasing. So multi-factor authentication, encryption of data at rest, encryption of data in transit, zero trust architecture is a big one that's coming as well. And so we were able to grandfather use of DHIS2 in as an open source product, and it's not as encouraged right now with the US government. So we really want to be working more closely with the University of Oslo over the next years to really continue to advocate for why investments in open source systems are so important, and demonstrating how those can actually work within United States government boundary, other boundaries where there's an increasing focus on cybersecurity, et cetera. And that gets me to the point that Kristen raised as well. So we continue to hear about how great it is to have free features in the platform and the importance for standard core, but that doesn't come for free. There's someone paying for those salaries and others. And so PEPFAR has been very fortunate in the ability for our funding to be able to be not implementation focused for the funds that we give to core software development. We do have a much larger amount of funds that we put into implementation, but that happens at our country level. So we have a core investment that goes there. We were able, I think NORAD and PEPFAR were some of the original partners that were able to provide that core funding. And for all the reasons that Austin and Lars have laid out this morning, we feel that this is absolutely important. And looking at my colleagues from Digital Square Path, where we coordinate our investments to University of Oslo for core software, we're looking to donors to be able to make that case more broadly. There's huge benefits to having a stable platform that we can use in a lot of different sectors, a lot of use cases. But in the early days, we were very nervous where PEPFAR was an outsized piece of that pie for the core software development. Those pieces have increased. The overall size of the pie has increased, and that's great, but we need to continue to advocate for why that's important. And then just I'll leave with the importance of working with indigenous capacity. The PEPFAR program has a target of 70% of our funds that go to the country level are focused on indigenous organizations. I think there's so many with the HIST networks, with others that are using DHIS2. There's just a huge community of developers that are doing this, but more broadly, even beyond DHIS2, huge initiatives around data science. And Rwanda just hosted an event in this year as well. And we're really looking at more data literacy, making sure that we're able to support platforms that are using data in all sorts of different formats, not just from DHIS2. And those are not sorts of things that you need to bring in outside organizations to be really meeting a lot of those sorts of needs. So very excited that we're able to continue supporting the DHIS2 platforms. Thank you.
Thank you. I think it needs a hand for this one. Thank you for that pledge. And Jörn, maybe you would like to talk about something else, but however, or you want to talk about
Easily talk
no
about
question.
PEPFAR, no problem. Yeah, no, one thing I wanted to raise because I noted that in last one of his slides were that open source is good because it's less bureaucracy. And what I will emphasize is rather that it's good, even research-based evidence that open source is enabling innovation, as it is evidence that proprietary software is hindering innovation. And that was the example from Andrew and Pamod on what happened during the pandemic, where the network of open source software actually enabled the sharing of best practices and even apps, and not necessarily only the apps, but also the way to do things, the best practices, etc. So I think that is very, very important part of everything. And it's also, I mean, after you, I have to mention something about PEPFAR as well. And we started to discuss with your predecessor, Mike Guerin, many years back. And at one point, I remember I asked him, why is US government coming here and supporting open source kind of anarchistic group like this? That's not very normal. And he said, yes, no, because we are progressive, he said, and also because the official reason was that DHIS is used in all these countries, and eventually we want to have interoperability and collaboration and leaning on capacity, etc., with these countries. So that was, according to him, then the official reason. But I think it's quite interesting that that this collaboration came about, and I'm happy to hear that it will continue into the future. We cross our fingers for that. And into this talk about PEPFAR and Mike Guerin, I want to say something about the future of DHIS, because he also had one other in our numerous discussions. He also said, I don't understand why you guys are not focusing on where you have monopoly, absolute monopoly, and that's aggregate data and that kind of analysis. And when we now think about the future of DHIS2, I want to raise that again, not only the aggregate data, but please remember that everything that has to do with analytics, M&E, etc., whether it's come I mean, on the run from the tracker or from medical records, etc. It's always about single units of numerical data. And the analytics coming from that tradition is what we have now seen is a big problem for DHIS2, because we have been so successful in making it possible to specialize into different systems, which is a good thing, because that enable participation and user control of the development. But at the same time, it creates a problem with the integration and different silos of systems, etc. So that has brought us back to where it started, and that we need to work harder on the analytics, and we have already had a lot of, say, competition from the systems and all these other kind of Tableau and others who are actually doing exactly what we did in the old days, saying that let's take data from all these sources, put it into one database, call it a data warehouse, and do our analytics. So maybe that is the future then, to go back to that again. Yeah, okay, thank you. I'll stop here.
I was thinking maybe, Austin, since the two of you had the presentation, maybe we should open for question to all of you guys. Or you have a comment, Austin? Yes, of course you have.
I was going to just respond quickly to the four previous speakers. So thank you very much for the comments. I wanted to start with Pramod and the sleepless nights supporting Sri Lanka. I haven't been yet to Sri Lanka, but I would love to go someday. So I had to support it from quite a far away. But I think you highlighted very clearly what is the power of a platform in addressing real needs and real urgent needs in public health, but in other situations as well. And then Andrew, you extended on that to say that it's a community. It's all of us are sharing our innovations and working together to address these problems, and that's really, I think, quite unique and enabled by that platform as well. I was in Rwanda with you a couple months ago with a group of 50 people learning about integration. And that touches on another point that both Mark and Jorn brought up, which is interoperability and integration are a part of that platform and that extensibility, and being able to play well with others and get data to where it needs to go. So it was really a powerful experience to be in with 50 people learning about interoperability with DHIS2 from 20 different countries or more. And then taking a bus across the border to Uganda to meet with some very talented developers in the network, in the community, working on building extensions and adaptations of DHIS2. So I think the interoperability is a really big part of our focus, as well as security. And I think that it was on one of my slides, but it's a big focus for us as well, is investing in first-class support for interoperability and first-class support for top-notch security, which has sometimes been an afterthought in the space where we work. And yeah, so interoperability and complex architectures and being able to get the data to where you need it to be able to do triangulated analytics on that, I think is really the way that we're going in the future. So looking forward to that journey together. That was my quick comment. Sorry, it was a little bit longer.
No. Shall we open the floor, Lars, or you want to comment?
I can just have one. Just a super quick comment to build on what Mark says and also Jorn says. I think, DHIS2, we do spend a lot of energy building out analytics, right? We have people, working very hard on it. But the thing is, we also built out very complicated, or not very, but a bit complicated tracker systems now, where people do, mother and child analysis, there's households and there's spraying and there's whatnot. And then the problem is that people come and say, oh, but we can't really analyze this data. We spend all this time putting the data in, but we can't look at it in analytics. And I would say that maybe we are putting a necessary constraint on the system and ourselves, because the data is there. I mean, the data is there, and there are things like there's a thing called SQL that allows you to query the database to get the data out and display it in a report. That exists, right? So, but still we say can't be done, right? But it can. So I feel like to kind of take some pressure off the DHIS2 analytics and, save the poor guys working on analytics day and night. We should be able to also kind of integrate the more ad hoc explorative analysis that we do find today in data warehouses and BI tools in DHIS2, because it can be done. It's just that we say that it can't. I would say that DHIS2 is really a fantastic tool when it comes to distributing analysis to many people, right? We know that implementing a data like a BI tool at scale can be difficult because of training and installation and costs. So like distributing analysis in DHIS2 is what the software does really well. So I think in the future now with the analytics team, I think it's going to be really interesting to see if we could try to combine the power of the kind of DHIS2 predefined reports and dashboards and program indicators with the more explorative ad hoc analysis that we can do in data warehouses and BI tools together.
Thank you, Lars. Any questions, guys and girls, from the audience? You have the chance. No hands? Yes, we have one. Pamod is not here for running anymore, so.
First of all, I just wish to commend you. This has been fabulous 4 days, really eye-opening at all levels. Oh, sorry, my name is Amani Siam. I'm the regional advisor for health information systems in the WHO Southeast Asia regional office. I'm responsible for 11 countries. 8 of them are using DHIS2 profoundly and strongly. So I just wish to commend you on this. Lars, I take your point. We're not going to ask you do this and do that and solutions and whatever, but I need you to help us, please, to, in a way, having like a marketing strategy for DHIS2. So the asks I have is that we are still trapped with the lower and lower middle income thinking for DHIS2. We need to, raise the bar on this. We have a few upper middle income countries who are really in a mess with their facility-based systems.
Yeah.
And there's something to learn there. So that would have been one thing, of course, to reflect on. The fact that it's not just the map and what you drew, it's the socioeconomic groupings that you have gained. And now that you're crossing over from the health to other sectors, you have to take that into account. The second thing is about data sovereignty. I think this is something we need you to package into your marketing. And I have to say, as technical agencies, we failed you a bit, because I think it should have been our responsibility to market the data itself and the use. We can't expect you to handle the informatics and the public health aspect as well. So you really provoked us by a lot of what you've said and what Jorn has said. So the two asks are definitely to raise the game, to speak more about upper middle incomes and what they can learn from. DHIS2 is not for Africa only or for Asia. Or it has a global dimension of applicability now. Second, the data, the idea that the data sovereignty is always guarded. And then third, I think what I would really ask you to consider, given all the collective partners, especially that you have a meeting coming up of the partners, in the sense that what I think my colleague from PEPFAR spoke about, the spectrum is increasing. Like for the Southeast Asia now, we have a big issue with dengue. It's again uprising. We still have a big entrapment with TB. So we have to look into cross-infection. So for me, the big education I had coming is the capture. The fact that we will definitely want to look at the profile of co-infections. What do they look like? And third, but of course, the NCDs. We need more to be done for the NCDs. And in that respect, I want really to urge you to have like a Marshall Plan to start thinking of patient registries that should be trapped by DHIS2. For instance, cancer. We still are not doing well in analyzing cancer data. And they complain about, we don't have good data. It's really hooked into very small places. So I'm just saying that if you can come up a bit more, as you say, you focus on quality. This is what Austin said. We are going towards quality. It's also speciality, not just quality. We have to show new offerings that we are able to handle patient registries, for instance. That will be a huge asset. You will open up a massive scale of data use if we can trap the new types of users beyond what we call the communicable and infectious diseases. So these are 4 items. I'm going to write you an email because I spoke too long.
Probably better.
Thank you. Thank you.
Yep.
Speaking of which, Norway was actually using DHIS2 for contact tracing. So it's not only the, upper and middle in Asia that is a mess. It's also Norway, to be honest. We have our own problems here. But that was more like a comment I felt.
Mhm.
So we have a question here. Thank you for the comment.
Thank you, Absalom Mamrima from Malawi. Of course, I just want to appreciate for the good presentation and the ambitious plans for the future of the DHIS2. My question, just want to find out if there's functionality whereby one is able to compare within countries, like in our case, we have borders, because we have some challenges, cross-border challenges when dealing with the immunization API, whereby maybe some there are cross-border issues. One country, let's say we have Mozambique, Zambia, Tanzania, with bordering our country. So there's this issue of cross-border challenges, and I just want to find out maybe there could be that functionality of linking that linkage between one country to say within the DHIS2 to say what they are doing in that country and that are bordering our country. Thank you.
Johan, you could talk about, we have many cross-border projects. We have the Mekong, we have the
cross-border project, yeah. Hello, yeah. Yeah, so we have a cross-border project between countries in Southeast Asia. And the big problem with everything that has to do with cross-border is to get a data sharing agreement. Because even though it's about sharing necessary data, for example, transfer, referral of patients between the two sides, it seems to be so close to national security, etc., that all the governments are thinking, wow, this is dangerous, so take it easy. But yes, cross-border movement is very important in healthcare. I mean, you have patients moving back and forth. You have malaria. We have a malaria project also in Southeast Asia, where all the countries agree on surveillance and monitoring malaria on the border areas. So yeah.
What about the East African community?
Yeah, that
collaboration?
we have the East African community also, but that's more like data to shared database. It's similar. We have West Africa Health Organization also having that kind of shared data across countries. So reporting up to a shared database, that's of course should be easier than to actually have cross-border direct exchange of data, because it require less agreements on security of data and MOUs, etc. But yes, we have both in the East Africa community and West Africa Health Organization.
I think so. Yeah, thank you. I am Tomeka from West Africa, WAHO, West African Health Organization. And yesterday we shared some experience on that. And I think so more than the other colleague in the other regional economic community, West Africa today, this problem of the data sharing agreement is not a problem, because among the countries, no border. The people are just circulating freely circulating one country for the other. We have a Nigeria, that's so no visa, no anything are required. So the challenge become for the health. Why to do to ensure that so the health problem not become the barrier for that free circulation among the people. And we, since the Ebola crisis in 2014, 2016, we have now a regional platform for the information sharing. And that regional platform, we are improving it every day to improve the information. That's so it's accessible for any country. That's what the data entry is done in each country, basic epidemic prone disease for the moment. And all other countries have access on it. They can do it until district level. That's so they can localize the point. Now we are putting information on the point of the entry that can be in the GIS module. So that the people know where the people getting entry from the other country and where the problem. That's so the problem of the, I think so, one of the difficulty in the other countries that so that free movement in the among the country they become here the problem. That is not problem in the ECOWAS. That's so what we are doing now and working with HIS to support us is to how to improve the platform to be really today we are working on the early warning system on that platform. That's so in any case notify that a suspected case in order how the other countries can take it as alert to activate the mechanism of the prevention for that point of the health security. Thank you.
Now going 15 minutes into the app competition, so maybe somebody will look at me. Oh, we have a question more. Okay, we can be short. Pakistan.
Well, this is Mustafa Jamal Qazi, National Coordinator, Pakistan for TB, HIV, and malaria. Ever since, I'm not a doctor, but I can be a very good manager. Ever since I've joined this assignment and I'm keep on very close eye on the DHIS2 and what problems we are facing right now, the sharing of data from the private sector to the public sector and from public sector to private sector, it seems very, very tough. And every one of them are engaged, not the public sector, but the private sector is quite engaged working in the silos. These needs to be, mandatory for the private sectors to share the data with the public sector so that we can integrate it, a proper data space into the entire DHIS system in the CMU. What we have seen so far, it is not happening, and seldomly, they talk too much, but they don't do that. So what I would be requesting that it should be done in latent spirit, and this is what everyone is in connection with DHIS2 for developing the software, and then they, manage their data accordingly. I would be suggesting that the public sector is the most, I would say that the key and pivotal for all the databases for the partners and supporters to work with it. This is the main problem. And secondly, I would be saying there are some cross-sectoral or multi-sectoral approaches in the DHIS2 is little lacking. We need to do that also, strengthening the multi-sectoral engagements into these diseases like HIV, TB, and malaria are also facing challenges in blood transfusions. So this could be the best indicator. Well, any patient or anyone who is actually transfused the blood, it should be indicated. So I would be inviting the DHIS2 to come to Pakistan and prepare a software for blood transfusions also, so that we can maintain the data and manage this thing. Thank you very much.
I can actually try to wrap up a few of these different different lines of thinking, maybe a little bit, and bring it back to the platform that we were talking about at the beginning as well. Data sharing is important, and Mark, you mentioned direct reporting using national systems and not having parallel reporting. I think there's a lot of similarities between that and cross-border sharing, not necessarily of cross-border migration, but of different countries reporting the aggregate data at the end of the day, right, that we want to see to track progress overall. And we see that as something that we're investing a lot in as the DHIS2 platform as well, is in being able to have the ability for multiple systems to come together to have the aggregate data from the result of a tracker program, for example. You want to get a count out of it at the end of the day, and you want to send that to your national HMIS. And maybe that national HMIS is sending it to PEPFAR, or sending it to Global Fund, or sending it to the East Africa region, or something like this. And there's a lot of, I think, opportunity for us to be able to bring that data together in using the tools that we have, and building in integrations also with other systems, because it's not always DHIS2. There's a lot of DHIS2, but there's many other systems as well. So building interoperability with those systems and being able to combine data from different programs, different countries into somewhere where it can be actionable. So bringing that data together to where it can really be operated on, I think is really valuable as a platform. I don't know if anybody else wants to.
Just one final comment. So the problem you highlighted, the way the HISP look at it from our approach, it's more socio-technical. So there is so much that the platform, technology can do, but it's more about the governance that you set up in the country, and the do as DHIS2 platform, the technology. It's more about how you approach the problem and work with the government, set up the proper governance, and implement in such a way that this cross-sector collaboration is made a reality.
Anyone commenting? Otherwise, I think we should give a big hand to the panel. We are very flexible on our ground, remember. So we are now transferring into the app competition.
Okay, so I get to stay on stage, I guess. I'm going to help to facilitate the app competition. So as we've been talking a lot about this platform, there are a lot of extensions and adaptations of DHIS2 that are shared. And we have an app hub. We have a way for people to build and share Android applications that are built on top of the Android SDK that were built on top of DHIS2. And so we had quite a number of submissions, very high quality submissions. Many of them were presented on a session on Monday. And and now we're going to listen to the 5 finalists present their applications. So each of them will have 7 minutes to present. And all of you at the end of that will vote on who you think is the best, or the most innovative, or the most interesting innovation that is presented today. So with that, I think my colleague Renee is online as well. So hopefully we can get the system set up. Renee is our developer advocate who helps to facilitate the collaboration of the developers in the community. We also have several presenters who are online as well. And hopefully we'll get that up shortly. Otherwise, I'm just going to keep riffing. All right, I guess I'm going to keep doing that. Does anyone have a question about the app competition or the platform, or want to comment on any of the applications that you saw in the previous session? I'm going to have to repeat it probably because I'm not sure we have a mic. 2 minutes? Cool. Sure. Is that going to continue like that for 42, 43, et cetera? So the idea is to really focus on that quality. Yeah, the question was, it's a good question. So I mentioned that there will be a year between version 40 and version 41 in the releases of DHIS2, and is that going to continue beyond 41? So is that just a 1-year thing, or are we continuing? So the idea is that we want it to be transparent and be able to share exactly like what our plan is, when you can expect things to come from the core team. So for 41, it will be in 1 year. Looking forward, we want to make that kind of a consistent pattern. We might change it again in the future, but looking forward, the current plan is that it will be a yearly release. That being said, we'll adapt as we go. So we do have also the continuous releases and the other ways that we continue to innovate and build on top of that. Yeah, thanks. Yes. Yeah, so we'll be sharing again more details about that. But the three release, so we support three releases, stable releases back. And what the immediate effect of pushing 41 to May of 2024 is that everything will be supported for an additional 6 months that's already out there today, right? So we have still the 3 release policy. Okay, sure.
The increasing sort of multi-sectoral use of DHIS2, how high on your agenda is the support for multiple org units?
Yeah.
Which would really help in, this sort of implementation?
It's a good question. So given given I'm going to repeat the question. Given the increase of multi-sectoral use of DHIS2, how high on our agenda is the support of multiple org units or multiple org unit hierarchies within DHIS2? And that definitely is something that is something we're thinking about a lot. It's not necessarily, again, going back to what Lars mentioned of problems and not solutions, there are different ways to approach that. And we would want to approach it in a way that makes sense and is scalable. Multiple org unit hierarchies as a concept is something that we're definitely thinking about. It's not on the docket for 41 at the moment, but it's definitely, I think you'll see some functionality towards that end, towards also managing larger volumes of org units that are of different types, using groups potentially to have the same effect as multiple org unit hierarchies, for example. So we'll, be able to share more about that in the future, but good question. Sure. How many app submissions were there? Does anyone have the total number? I think there were something around 40 app submissions, 30 or 40, maybe a little bit less. I don't know if anyone has the number in front of them, but yeah, there were quite a few this year, and there were quite a few high quality ones. So we had 5 that presented on Monday as in web applications, and then we also had the 3 web application finalists that are today, and we had 2 Android application finalists, plus a number that were interesting as well in that. I'm not sure if I'm just going to keep talking here or if we're we're going to start the app competition. Hopefully we can do that soon.
So there's a problem.
Yeah.
So no solutions assigned. There's a problem where
Yeah.
if you have org unit groups, you group your org units or data elements over time and they change. You don't retain the data historically. Is this something you find as a problem as well that requires some solution in the future?
So yes, I absolutely think so. So I think this is part of yes, sorry. The question was around if your metadata changes over time, the data becomes associated with different things or gets lost potentially in some situations. So how do you manage the changing metadata and the effect on data in a system? That is, I think, a big part of the managing metadata over time push that we have. So in addition to just being able to manage your metadata, you need to say, how does this change over time? What does that effect have? What effect does that have on the data that is in my system? So being able to merge and split org units, for example, being able to combine data elements and be able to have basically migrations for the data is definitely something that is part of that push in 41 and beyond. How are we looking, Max? So this is we will be going to, I believe, to Songswon for the party in a little bit. since I'm up here and we don't have an agenda, I'm going to invite anyone who would like to go for a run with me and about 10 other people who are going to be jogging around Songsvan Lake later today. So if you have your running equipment or want to run barefoot and then jump in the lake afterwards, you're more than welcome. It's a very nice flat 3-kilometer course that goes around the lake. It's very beautiful. So feel free to join. And then we'll have lots of other games and things like that, I think, around as well. We've got something going on here. Sorry, we're good? All right. So without further ado, that was much ado, but we will have less of it. We are going to turn it over to the app competition. So we have a number of finalists, and hopefully Renee is online and can help me to introduce the first of those finalists. Renee, are you there with us? Can we hear you?
I'm not sure if you can hear me, but I can hear you.
We can see you, but we cannot hear you. Working on that.
All right.
I don't know what he's supposed to say though. He's got the list.
Do you hear me now?
Still no. Apologies for technical difficulties. We were doing so well. Renee, can you try again?
Yeah. Hi. Hello. Still no audio? They can hear me on the Zoom call at least. And so now the question is, can you hear me in the audience?
What's the run like? Yeah, it's 3 kilometers, 2 miles flat around a lake. Cool. What's the prize for winning the app competition? So we have badges on the community practice for all the winners of the app competition. We also provide basically sponsored attendance at one of the app developer meetups that we have. So we've done that in the past as well. Yeah, and we actually have I think Gift is still here. Is Gift here? Gift? I don't see where you are. There, way in the back. Gift was actually the winner from the app competition last year. So let's give a round of applause to Gift. With his Tanzania. Gift, do you know any jokes? Sounds promising.
Looks like I'm off the screen already. Can you hear me yet?
Yep, we're getting there.
All right.
Okay, next time you guys got to give us time to set up between sessions.
Yeah.
We're good now.
So you can hear me in Oslo?
All right. Renee, you're on. Thanks.
All right. Okay. I'm going to keep this relatively short because we're a little bit over time. But first of all, I want to thank everyone that has submitted an app to the app competition. There were outstanding applications this year. And as Austin already mentioned, we had a really tough choice in selecting the finalists. We've selected 5 finalists in the end that we think should be in the spotlight today, and you really should enjoy the presentations that are coming up from them. There is, let me see. I have, as Austin mentioned, I have the list in front of me, and we're going to start off. I'm going to go with the order a little bit, and then I'll explain how the voting works. First of all, HISP Uganda, Albert is going to show us the visualization studio. And Salih Yusuf from HISP Indonesia will show Jumpa Doctor, an Android application. Then there is Eric from HISP Tanzania, who will be showing us the Analytics Messenger. Then Chaturanga, I'm sorry if I don't pronounce it correctly, will show the growth and nutrition monitoring system. And then finally, we have Nacho from ICT who will show the homepage app. And we have 2 Android applications and 3 web applications this year. And they will all be sharing the same, all be in the same pool, unlike last year, if you're familiar with how it went last year, that we had a separate vote for both Android and web. There will be a vote after the presentations are done. And that means that once the last presentation is done, you can go to the community of practice to vote. There will be a poll up as soon as the last one is done. I will be sharing a QR code so everyone can just take their phone and scan the QR code and directly go to the COP and make sure you're logged in there, and then you can vote. Okay, I'm just going to hand it over as we're half an hour past the scheduled time, which is totally fine. There is 7 minutes for each finalist. And Albert, I'm not sure if you're already a co-host, but I want to hand it over to you, unless there's anything I need to mention before that, and then you can start your presentation.
Thank you, Renee. I'll share my screen. Please confirm that you can see my screen.
Yes,
yes, I can see it here. Yeah.
So hello, ladies and gentlemen. My name is Albert Mutesasa from HISP Uganda. And this afternoon, I'm thrilled to present to you an innovative solution that addresses some of the limitations of the current dashboarding tools. And that solution is the DHIS2 Visualization Studio app. Now, this application is a dashboarding tool that aims at revolutionizing data analysis and visualization by tackling the several crucial challenges that we have right now. Now, previously, the DHIS2 community has often been facing a challenge of lack of real-time data updates while analyzing data, secure public access in form of public portals, intuitive visualization of data on one instance for multiple data instances or data sources rather, including different DHIS2 instances and also data from other external systems, which are non-DHIS2. We also looked at highly customizable charts to the liking of the user. Now, this deficiency significantly hampers effective analysis and visualization, especially when real-time insights and public accessibility are of utmost importance. Now, the solution, on top of the problem, the previous solutions were project-specific, thereby I'm having trouble with okay, good. Previous solutions were project specific and required developing dashboards after dashboards, and they were time consuming. So above all that, we come up with a solution, which is the data visualization application. And this offers live data monitoring. This enables real-time data analysis for timely insights and decision-making. It also offers display of data from diverse sources, including different DHIS2 instances and other non-DHIS2 external sources. It also offers an ability to create custom indicators using metadata, and it can be metadata from different DHIS2 instances or even other non-DHIS2 instances or non-DHIS2 systems. It also provides the ability to access dashboards without login, but also putting security without compromising security. It also offers the ability for flexible chatting, meaning that it provides a versatile and customizable chatting system for effective and visualization. Did I mention it is also highly customizable to the dot. This work we have done some collaboration with one of the HISP groups, which is HISP Rwanda, and it came on board in the later stages of the development because they were facing a similar problem. So we have been working together in terms of collaboration and using different tools to come up with a perfect product for this one here. We have used this application in a number of use cases in Uganda here. One of them is are the campaign dashboards. So we customize the campaign dashboard using the Visualization Studio application, and these are real time, meaning that data is displayed as it comes in. We've also customized the Uganda Manifesto dashboards. This is in the department, this is in the Office of the President. We've also worked with the Ministry of Education in Uganda to customize the school-based surveillance dashboard using the Visualization Studio app. We've also worked with the WHO in Uganda here to come up with interactive dashboards or an online visualization tool, which was also customized using the Visualization Studio app. We've also worked with the surveillance department in the Ministry of Health to come up to customize the EVD dashboard, and this is real time also. These are screenshots of some of the use cases we've worked on. This is the polio vaccination campaign dashboard, which is real time. This is the Office of the President, the manifesto dashboard. This one is not real time. This is the measles rubella campaign dashboard, and this is also real time. This one is the WHO dashboard, the online visualization tool, which was also customized using the Visualization Studio application. This one is the screenshot for the SBS dashboard, the school-based surveillance dashboard, which was also customized in using the Visualization Studio application. This one is the yellow fever application. Now you must be seeing zeros because this is real time. Data is going, these are queries already waiting for data to come in to be displayed. And as soon as data comes in, the data will be displayed here, and it has a refresh interval of 10 seconds. So after 10 seconds, it refreshes the dashboard and it displays this data here. This is how the application looks like. And with that presentation, I'll take you through a small demo of what this does. So this is already a dashboard that I have made before, and I'm going to show you the process of creating a dashboard. So here you create a data source. As you can see, we have different data sources here. This instance here is the eidsa.health.go.ug, but I've created more than 4 data sources. One of them is this one that is coming from the HMIS, and you see the URL is different. This other one is the ECBSS, which is coming also from another instance. The URL is also different. And after there, you can create a category, which is like a program area. Then you go ahead and create a visualization query, which I've already created one, so we won't have to go through that. Then after creating a query, you can create an indicator, which in turn we are going to use to create a dashboard. So I've created one dashboard for this particular purpose here. And I'm going to show you how we create this one. So like I said, it is highly customizable from the filters to the dashboards to the logos, etc. Now, assuming that I have another sponsor for this particular work I'm doing, I can just go ahead here and add a logo for that particular sponsor here. This is going to be an image. I'll add the image. Then after adding the image, I can upload this image. Let me get, maybe HISP Uganda is sponsoring this one. And I apply that, and my logo will come down here. Let me say I have another sponsor here. I can add another sponsor down here. These are already created dashboards. This is already a created dashboard. So I can add a single value here. Like this, I add a visualization. I give it a title. Let us say presumptive TB cases, right? I can come here. My query is this one here, which is the percentage of presumptive TB cases identified in OPD. And this time it is a single value, something like that. So it is 0, but since it is a percentage, I can say my number format style is a %, something like that. So I can play around with these configurations. I can play around with the title. I can different configurations.
We're at 7 minutes.
Okay.
But that's a great presentation and a great dashboard. And thank you for sharing your Visualization Studio.
Okay. Thank you.
I have a question. Is the next presenter in the meeting? Because I'm looking for Saldi Youssef from HISP Indonesia for the next presentation. Okay.
Okay. Apologies.
Yeah, we'll move over to the third presentation, and hopefully Saldi Youssef will be here with us soon. But then next is Eric from HISP Tanzania, and he will show the analytics messenger. Eric, floor is yours. And I cannot hear you yet.
Hello, everyone.
Yes, perfect.
Yeah, I hope you can see my screen.
Yes.
All right, so I'll start right now. Yeah, my name is Eric Chingalo, system developer from HISP Tanzania, and I'll be presenting to you the DHIS2 Analytics API messenger. So just a little background, over the past 20 years, we have seen the evolution of the DHIS2 as a platform, but this has been greatly influenced by the technology trends, from having Microsoft Access as database to having the DHIS2 capture app as a mobile technology. So in light of this, we also saw a massive growth in the use of the social messaging platforms such as Facebook, WhatsApp, as the number shows over there. So this brought us an alert that we have a potential of bringing DHIS2 closer to users through these social messaging platforms. And that's where the whole idea around the DHIS2 Analytics Messengers come about. So you might ask what this app is. DHIS2 Analytics Messenger is an application that leverages the use of the DHIS2 Analytics together with the popular social messaging platforms such as WhatsApp to deliver analytics closer to the user. It mainly takes the DHIS2 Analytics and brings them to the user through these messaging platforms. And you might be wondering how did we end up doing all this? So we divided this solution into two components: the analytics assistant, which is a chatbot solution, and together with the analytics messenger, which is more like a push analytics solution. This is the web app. So for those who are having smartphones, you can try to scan this QR code to see the analytics assistants. You are very welcome to join this demo as I explained. Well, once you scan this this QR code, you can just type hello DHIS2 or hello, then you'll get more of a instruction on how you can get the visualization in a more easier way. So within less than 30 seconds, you find yourself having the visualization is how this video shows. So I'd urge you all to scan and view this, but these resources are going to be available after this slide. This is only one part of the DHIS2 Analytics Messenger. Well, the second part is the Analytics Messenger itself. This is a web app now that allows pushing of the DHIS2 through the WhatsApp number, WhatsApp groups. So this now allows you to have a WhatsApp group configured, and you can be able to send your numbers there, send your visualizations there. So you can scan this QR code and be able to join this group, or scan this link over there. But you might be wondering why only manually. So this also allows scheduling of this push analytics. So you can schedule the analytics to be sent automatically, but also we are using this messenger app to configure these analytics in the web app so that you can be able to configure the analytics which are publicly available, but also to configure the flow through the chatbot that I just presented before. Well, we can now try to see the demo of how this web app looks like. So I'll go to the instance. So this is the demo that we are having. So our app is called the Analytics Messenger. And within this app, as I said before, you can configure first the gateways. This is more like a communication between your DHIS2 instance and the analytics services. But also on the other hand, we are also allowing you to configure the visualizations which are publicly available through the Messenger app. So in here, it's very simple. You just have to name your group, let's say the TB, and then you can be able to filter among the DHIS2 existing favorites. So let's say here, this is the list of favorites coming from the DHIS2 instance. So you can search from them and select which ones you want to be available. So this is more like what we are having right now. But that's just the configuration part. The fun part is the analytics, push analytics part, where in here, you can be able to push your analytics. And you can do it by just naming your analytics. Let's say I'll name this as API, and then select a gateway service that you're going to use, which is already configured to sending these visualizations, and selecting which visualization group you want to send together with the actual visualization from the filtered list. You can also send messages concerning this visualization, let's say the simple description of this visualization. But the fun part is we're allowing you either to send through WhatsApp groups, through phone numbers, but also through WhatsApp group, through phone numbers, but also through DHIS2 users configured. For the sake of this demo, I'll just use the group, and you can scan the QR code. For those who are able to scan the QR code, you'll be able to see this visualization. I'll bring you back to the slide later on. So, okay. Very sorry. It seems like the server has gone down a bit. Yeah, so we have received a number of requests. So it seems like the WhatsApp server has gone down. The technical team is going to help me to set it up. So yeah, by configuring this one, you're able to save, and this person can get this visualization at any time. So what we have done, we are allowing you to either send them directly or schedule them. So for instance, I can try to schedule. I had this already created. So I had this deck. So for those who are joining the group, will be able to see this. You can schedule it up and add your scheduling mechanism. And we have made it very easy for you. So you can say, let's say your visualization, you want it to be sent every day midnight, for instance, or let's say 5 minutes. So by just adding this, after 5 minutes, those members joined by the group of DHIS2 visualization will be able to get these visualizations there. Well, you forgive me for the server. Seems like it has been down. We have lots of people here today. So I'll continue the slide and I'll present to you. I don't know if you are seeing my screen. So what are the impact of this solution? First of all, as a senior manager, you'll be able to view visualizations directly. As a senior manager, you'll be able to instantly get data directly from the assistant, but by just making a normal conversation. While on the other side, as a national program manager, through the DHIS2 Analytics Messenger, you can send your visualization to the program managers group so that they can get more notification concerning it. Well, this has been all. I have this COP post in the community of practice. You can try to scan this QR code. All the resources are going to be found here. And for those who aren't able to follow up the demo, we'll share the links there so that you can follow up easily and get to know more about us. We can also chat through our email, info@hisptanzania.org. Thank you so much for your cooperation. That has been all. Don't forget to vote for us. Thank you.
Thank you, Eric. That was
maybe just to rephrase, like we are going to sort out the server issue. It seems like we had lots of requests from the members, so you will forgive us for the inconveniences.
Of course. Thank you for your amazing presentation. And you were nicely in time, so perfect. We're gonna move over to the next presentation. This is going to be done by Chaturanga from HISP Sri Lanka, and they will present an Android application. The first Android application that we had planned is either going to be moved to the back. Hopefully, Saldi Yusuf will be here in time. But until then, Chaturanga, good luck with your presentation, and the floor is yours.
Yeah, thank you so much, and good afternoon, everyone. I hope you can actually see my screen over here.
Yeah,
and
can see it.
Yeah, so I'm presenting. I'm Chaturanga from the Ministry of Health, Sri Lanka, and I'm presenting today Growth and Nutrition Monitoring System, a custom-made Android-based mobile application, which is developed by Sri Lanka, HISP Sri Lanka, and which actually using the Android SDK, which is provided by the DHIS2 team, and which acts as a tracker capture program on DHIS2 for the ground level field health officers who are like, public health midwives. So when you initially come to the application, when you click on it, and you will be prompted with the login screen. And as you can see, I have actually logged into the application. So once you logged into the application, you can actually see these the trilingual, like, we have multicultural ethnicities. So we have Sinhalese, Tamil, and English. So I'll head on to the English version. So when you're inside the application, you'll be prompted with like dashboard, and where you can actually get the information from. And on the bottom of the screen, you can see the syncing and the changing of the language if you accidentally hit on it, hit on the wrong language. So in here, you can tap on this. In here, you can actually see all the registrations and other programs such as like, supplementary feeding program, therapeutic feeding program.
I'm sorry to interrupt, but we don't see your screen moving.
Can you see?
We see the login screen.
Really? Hold on.
Yes. I'm also pausing the timer for a bit to make sure you're working again.
Give me a minute. Can you see the screen now?
Yes, I see your screen. Yeah.
Yeah. So I'll start from the beginning. So once you're logged in, you can see the trilingual interface, and I'm going into the English language, and you can actually see all these information at a glance. You can actually see all of this, and the different programs we are actually having, like therapeutic supplementary feeding, therapeutic feeding program, likewise. So in View My Area Details, if you go into that, you can actually see all the children which are in your area, like, this like ground level field officers can actually have a look at their children in their area. So all children and active, and once their children is completed, like, they have received all the treatment, it'll be in the completed area. So once you go back to the dashboard, you can actually see this child registration, which we have actually categorized into 3 parts, where the child's information, whereas like the Gramanila area, which is the smallest administrative area in Sri Lanka, and birth and immunization registration number, and the name, age, like date of birth, all of that, ethnicity, all of that information. And then mother, like mother's name, national identity card number, like that. And if there is, like, unfortunately, if the mother is passed away or something like that, then the caregiver's information and the birth details of the child. So I have prepared a child already. And once you enter the child's details, you can actually see the child's details as in a matter of like this. So if you have accidentally entered different data, you can actually simply tap on the edit button, and you can change the name like that and submit it again. So now I have already enrolled this child into like few different programs. So the basic information, like, the anthropometry tracking. So anthropometry tracking is like, it continuously happening, like repeated data, periodically done by the ground level field officer, right? So it's a spontaneous plotting in the system. So once you actually enter these data, you can actually see in a graph, like we actually have this graph where we can actually plot the data, and you can get a good information about the child, how this child is actually receiving these treatments. So also I want to highlight that in length and the weight, in the length and the weight programs, we have incorporated this color scheme of this the charts So if you put like something like this, it'll go into a red color, or if you put another value, like, it depends on the age of the child. So when you tap on that, you select submit and plot the chart, and you can see that it should change. See, it has changed. So that's actually incorrect data. That's why it has gone up. So like that, you can actually have the anthropometry data. So in the nutrition specific intervention tracking, we have separate application in the system. So we have this supplementary data, therapeutic data program, likewise. So I'll basically all these application have few sections, like enrollment is a one-time action, and the system intervention monitoring, which is done periodically to facilitate of data entry and those intervention packages. And then evidence-based intervention following of outcoming of the child of following these interventions, such as recovery. So I'll go into this supplementary feeding program. So indication for Triposha, which is the supplementary feeding program we are actually giving away for the children. So you enter the date, and let's just say that this child is having moderate acute malnutrition. You submit it, and that is just one time. So then you have the intervention, which will be repeatedly, like periodically happening. So I'll just say no Triposha, or let's just say that this child is on Triposha. So how many packers we have given the child. So whether if the child is given any counseling, yes, like that, we can submit it. So once it's done, we have the outcome of it. So you select the child, and you select what's the outcome of this child, whether if the child is recovered, whether the child is sent to therapeutic feeding program, or defaulted, or left the area, or left due to completion of age 5, because this is targeted on under 5 children, and whether the child has passed away. So then again, I want to highlight that this is, we are going to collaborate with this cross sectors, like it's system. The uniqueness is that we are actually going to get involvement of these multi-sector people, so cross-sector collaboration with them. So we have developed the web-based system from the mobile application, the Android application. It will just.
I'm afraid I have to interrupt you here. That was the 7 minutes. I gave you a little bit extra time because of the technical difficulties that were out of your control.
Yeah, could just give me like 1 minute or 2 minutes.
No, we need to keep everyone to the same time. But if you have a final word, that would be okay.
Yeah. So this will be the the select program. You have like a section of like reason for enrollments. We have whether the moderate acute malnutrition, long-standing. Likewise, we have selected a few of these problems of the child. Let's just say that this child is again having these problems.
Yeah. So sorry. Yeah. So that's. Yeah, of course. Sorry, I have to interrupt you here, but we're going to be having to keep everyone to the same time. It was a great application. It looks really good, as with all the other presentations so far. But thank you. Then it's up to Nacho. Are you here? Or the homepage app? Yes, I can hear you.
Okay, perfectly. I'm going to try to share my screen. So please let me know when you can see it. Can you?
I can see your desktop. Yeah.
Yeah. Okay, perfect.
Yeah. Good luck.
Thank you. Thank you so much. And hello, everybody. I won't be super long. And they actually will cut me in 7 minutes. So there's no chance that I'm not short. And we will be parting right after. I'm with you in spirit, but I'm physically like 15 meters far from you. There were some technical issues in that building, and so I needed to present remotely. I'm here to announce to you that at ICT, I'm Nacho from ICT, and at ICT, we had a baby. actually. And this baby is now 9 months old. We are super proud of her. She's doing very well, and is coming to a family that is this family DHIS2 ICT suite that I'm presenting you here. For those of you that don't know what we do, we are doing what we think is creating community by creating multiple applications, generic applications that you can install on top of a Bare DHIS2 to extend the functionalities that often are not so easy to be done in DHIS2. So you have here applications for creating trainings, distributing metadata packages, synchronizing. You were talking before about the cross-border data exchange. So metadata sync will pretty much do that job. But let's focus on landing page. Landing page has been trained by the training app somehow by her big sister, because it's inheriting most of its code from the training app that you might know. It won the competition 2 years ago, and basically it is fully interoperable. So if you create a landing page in training app, you can import it in the homepage app. And so this is like trying to solve some problems that are coming both from shared instances. You know that in shared instances, having groups that see different things when they log in. So this is about what you see after the login is important, but it's also important in some instances that are only for one purpose, to guide the users into something that makes sense for them. Let's go directly to the application. So when you install the homepage app, you get this. So this is not very useful, obviously, but then you can go to the settings and you have two main sections. One is the landing pages that you have, that is here on top, and then the actions. The actions, you need to think on them about shortcuts to a place in DHIS2. It's basically that. You can create both of them from this plus button, adding a landing page or adding an action. If you add an action, you will see well, very basic information that you need to fill in, like styling of that action, how that button will appear in the screen. And then you can decide also what is the application that needs to be launched by this shortcut, and which are the compatibility of those shortcuts, because you can export them later, and you need to be sure that that will work or not in the final instance that you're installing this. So that's about the actions, but let's try to edit a landing page very quickly. I have something prepared. So I'm gonna just put a name. You will see in a couple of minutes, we will have a landing page. So I'm going to create a landing page for World Malaria reports. I provide an icon. I can define many other properties, like do I want the sections to be in line in the same page or multiple pages? And then do I want to attach an action? If I don't want, then I just, put some comment, some text. This is an editor that is, for those of you that know Markdown, this is basically Markdown. So you can explore your own configurations. I go out and I already have a landing page. That makes sense, more or less. It's pretty simple. Then why not? I could, with Markdown, put some links here and link this enter data and visualize data sections directly to the place in DHIS2, something more complex. I want to add sections there. So what I'm doing is, I will create a section whose name will be this, enter data, and then an icon. I'm going to associate a data entry shortcut to that and put some meaningful text. I copy that text here. And I save it. I'm going to do the same. Now I have a landing page with a section here. I'm going to do the same at another section with the visualizer part. So visualize your data is the name of the section. And then I'm going to select a dashboard icon here that will look like a dashboard, and then select the action, so the shortcut to the dashboard application. And some meaningful text here. I do no longer need this because I'm converted that into sections. So I'm going to delete it. And just go and see how it looks like. You see, in a couple of minutes, we have created a landing page where we have sections. You can navigate and you can click, and it takes you to the place that you want to go in. You don't need a developer. That's the magic of this. And then, but I want to show you also some other features, like, for example, I can import what you saw, and now I have 2 landing pages. I go out, I have the selection because I have access to both. I can select which one I want. And you see, it's a landing page with its sections that is pretty much what I want. And well, later you have like sharing settings that you can do, but also you can export translations. Translations will look like, it's super simple actually, will look like this. So you see, this is quite easy to translate, and then importing it back, it's just importing that. That is it, what I wanted to show you. There are more features, but I don't have time. So just the last say to recognize that we are all working on giant shoulders, and these are my giants. These are all the enormous team of ICT. And I wanted to thank also the Malaria Department of WHO and Samaritan Purse partners, that they have been collaborating with us to making it possible. And also my 2 little giants that are waiting for me at home. And thank you all. This is done. And please, if you like it, vote for it. Thank you.
Thank you. All right. That's a great presentation, great apps. So far, we've seen 4 of the 5. And I've yet to locate Saldi Youssef from HISP Indonesia. If you're here, please let be yourself known, because otherwise we'll have to move on to the voting rounds. I'm going to give you a little bit of time because I don't see you, so maybe you're there under a different name and I don't know you're here. All right. All right. To give everyone the information how we are going to do the votes, I think we should go to the votes here. This is also the sign for you to put the poll up on the community of practice. I will share a QR code on screen that, let's see, there we go, that you can all hopefully see now. There's a QR code there, which will link you to the voting. And I have a timer on screen as well that I will start now. And when the timer is done, we will close the votes and the winner will be known. So maybe a final round of applause for all the app presenters today and the finalists. All right. I'm not sure if there's anything that can be said in the audience while everyone is voting. I'm going to vote myself as well. It's only right. Already 54, 56 votes. Keep it going, people. It's going very fast. All right, 110 votes, people. That's amazing. Let's see if we can have more votes than last year.
We did have promises from our hosting provider that this wouldn't happen, but we do have a number of people getting too many requests, unfortunately. So we'll try to maybe move off of this platform for the next the next time we'll do this. Unfortunately, keep trying. Hopefully we can get some more people in. Apologies for the confusion.
The vote count is still going up, so a lot of people still have success. So that's good.
I think it's a number of requests at the same time. So keep trying and maybe you'll beat your neighbors in a race. Can I get a show of hands for anyone who has not yet been able to vote? All right, a few of you. Keep trying, please. Sorry.
One 142. Still votes coming through, so that's good.
Once again, anyone still not able to get through? Okay, fewer. So please keep trying. You will get through, I hope. Sorry.
Last call.
5, 4, 3, 2, 1, and fireworks. Hopefully everybody had a chance to vote. If you didn't, I apologize. You can write in your vote later and we'll have a recount.
All right. The poll is closed. I'm going to stop sharing that screen. We also have the results. I'm not sure if everyone can actually see the results, but we do have it. It was actually very close, I must say, between three different. They were all within a couple percentages of each other. But I'll go start with the third place. Again, I don't know if anyone can see this, but the third place is the visualization studio from HISP Uganda with 24% of the votes. Then on the second place, it's the homepage app from ICT with 26% of the votes. And on the first place, and congratulations for landing first, is the Analytics Messenger from HISP Tanzania by Eric Chengalo. Congratulations.
Thank you, Renee, for getting us through that. And thank you, everyone, for your presentations, the finalists, and congratulations to HISP Tanzania, our winner this year. And now we will have some logistics, I believe, for the next part of the evening or the afternoon. Okay, you want to open it on the screen?
Open, you need to open here. Oh, okay, but.
Okay, we have to go, we can maybe just open it. Yeah, like where we're. Oh, yeah. Yeah. So now it's time for the Menti, our traditional Menti to close the annual conference. So please go on menti.com and use the following code 87603476. Menti.com.
Hopefully Menti can handle so many requests at once.
Yeah, the code should be showing here. Sorry, I'll put it back for now.
Yeah.
87603476. Is that okay?
Check, actually. Okay.
So first question, did the annual conference meet your expectations? Yes, 100%. Yes, more or less what I expected. Partially, but a bit disappointing, or not at all. Yeah. 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 Let's go to the next question.
Just ask the people next to you if you need the code. We need to move on. Sorry about that. It's supposed to show up here, but yeah.
Please describe how the annual conference did or did not meet your expectations. Great content. Oh, sorry. Okay, maybe let me use this one. Is it better? Oh, yeah. Okay. So please describe how the annual conference did or did not meet your expectations. Too many sessions, met my expectations. Fantastic. Good. What do you think of the length of the conference? 4 days is a good format. It was too long. 2-3 days will be better. Or it was too short. Make it a few days longer. I won't say anything. What type of session did you like the most? Plenary, parallel, or use case bazaar? Seems like parallel sessions were the most popular. Next question. Were there enough plenary sessions? Yes, it was the right amount. I would like fewer, or I would like more. Seems like it was the right amount. Were there enough parallel sessions? It was the right amount, or fewer, or I would like more. Same, that's good. Were there enough use case bazaar posters? Seems like it was the right amount as well. Please share how we can improve the use case bazaar. Less bazaar, fine, more categorization, too many.
Seems like someone more, so that's a nice feedback.
Just make them on the paper poster. Okay, let's move to the next one. Would you like to see other types of formats in addition to plenary, parallel, and bazaar sessions? Yes. Okay. Let's see the suggestions. Hackathon, training, workshops, country experiences.
I saw speed dating.
Demos, practical sessions, trainings.
Yeah, these are great to bring forward to the next year.
What were your 3 favorite sessions this year?
AI is pretty big. Maturity, security, interoperability. I saw usability testing there, which makes me happy. Future DHIS2. Yeah, looking back and forward. Hope most people have been able to join with the code. Sorry, it's supposed to show up here, but you can also go in and submit feedback at a later point. So when you have the slides, you can also go in and submit some more. So it looks like there's a great variety of what people liked, which is really good to see. And here are some more topics, if there's anything we didn't discuss or you would like more of. So I see sustainability, more integration, but also no is pretty high. That hopefully means we covered a lot of your interests. Women in tech, I agree. We had a nice little session on Monday for women in DHIS2, but it would be great to expand on that one. Yeah, I think we can move on.
We were 350 participants. Is that a good number? It worked well, so that's good. Then I think we can be more.
Do you have a comment to that?
No. Your general feedback suggestions for improvement. How can we improve the annual, sorry, African meals? Yeah, we can look into that. Hot foods.
Yeah, a lot on the food and the visa process.
Visa, that is
which-
so true.
Yeah, we know there were some issues with that.
African meals again.
More women presenters, agreed. Host in Asia. Well, we do have the Asia conference. For those who might not know, we also do have an Asia regional conference in the fall.
In December. Oh, December, okay. Yeah. Go ahead.
What do you think was the most valuable, important thing you learned? And I saw meeting new people, innovations from the country. Where are we now? Ownership. Yeah, there's a lot of different things here. So that's great. Cross-sector use, that was a big focus this year. So that good that people found that useful. And also the DPG focus as well. Yeah, I think we'll move on just with time.
What do you think of Drifta, the annual conference app we used for the agenda of the conference? So it was great, made it so much easier to know what was going on. It was okay or not useful. I prefer the good old Word document. I prefer Sked, the platform used the previous years or didn't use it. So yeah, it was okay, apparently.
That's mostly good and okay.
What did you think of the quality of food? I guess African meals will come back. Good, great. I heard some comment in the audience.
We also had the food comment earlier, so. Okay.
Good, love it. Add Asian food. African foods.
That would be fun actually with our with the Senegalese restaurant we have in
Yeah,
Oslo.
I promise we will try to look into that next year.
Okay. Next one. Or was that then?
I think the end.
No, son?
Yeah, I think it's the end.
Okay, thanks all for your comments. Here's the code again if anyone wants to go in, but now we're moving on to our beloved Kahoot. I'm just gonna move this over here for a second. How is the sound on this? Do we want the Kahoot music or are we okay? There we go. Yeah, so here we at least have the pin and the QR code. So please join. Please let me know if you can't join. I think this one, we won't have too many requests, errors, hopefully. So I don't know if we're still online, but 400 people can join. So I think that's the highest limit we've had. I also like the new avatars. I haven't seen those before.
Yeah, you mix this too.
Guessing still some people need to join.
How many are in the how many are connected now? 97, yeah.
Have most people joined? Anyone? Okay, I don't hear anything, so we might get started. You can also join as the game goes, I guess. Okay, let's start. So about 20 seconds per question. So first question, if you remember this from Monday, how many countries were represented at this year's annual conference? 53, 73, 63, or 83? Yes. 73. Someone commented last year that the highest answer was always the right answer. So that's not happening this year. Always, at least. Okay, Jay, 1,000 points. Very impressive. Well, after a while, we'll try and figure out who's who, but we'll move on to next. How many abstracts were submitted for this year's annual conference? 59, 179, 129, 249. There's a little bit of a different number presented on Monday, right? So I went for the
Yeah,
closest.
but
Yeah.
this is the last time, yeah.
120 or 179. Sorry, I said the wrong. Okay, guy next to Austin.
Where is Austin? Right there. Oh.
So guessing it's Famud. I'm sorry, I'm revealing your identity already. So when did this conference change its name from Experts Academy to Annual Conference, which I still think I said a lot this year. So was it 2021, 2018, 2020, or 2019 that it changed to be the doc? (2019). If anyone thinks any answers are wrong, go to Ula. Okay, Vlad. Yeah, don't, it's not mine. Okay, an often discussed question. What does DHIS2 currently stand for? Currently, at this, well, now, if you remember what Austin said earlier, as a hint. This is a very contested question that we always. Yeah. So as Austin said, currently now it's just a name, it's just an acronym. And people still guess more system than software.
You can read more about it in the news section of our website.
All right, Ula. Okay, which country was the first national scale mobile web-based HMIS implementation of DHIS2 in 2010? This might have been in Lars's presentation. Yeah, good memory, good memory. Ula's still in the lead, but he's disqualified, so Vlad is. So here, the HISP center staff are working remotely. Yeah, 58, good. Lots of people got that. Oh, no. All right, let's see. When is the sunset in Oslo today? So try to put both. So is it at 10:41 p.m.? Is it at 7:41 p.m.? Is it at 9 p.m. or is it at 8:41 p.m.? I don't know why I didn't do 9:41 p.m. Please pretend it's 9:41 p.m., please. Never. Yeah, good one. This one was the latest. I wanted to do that. So hopefully we're all at Sognsvann still, right? When the sun goes down. Okay, what app is this? So there's going to be an app icon. So is it the horizontal bar chart app? Is it the data entry app? Is it the import export app? Or is it the reports app? We'll see if you know the new icons. Yeah, most people knew it. Oh, Joe, you knew your own icon. Yay. Okay, guess the DHIS version. So 1.4, 238, 218, or 229. I'm trying to remember if this was also controversial last year, but I don't think so. It could, of course, be other versions around that area, but you know, the closest one. Yes, 218. Definitely not 238. Right? Which one of these is not one of Pivi's friends? Is it Appy? Is it Tracky? Is it Mappy? Or is it Entry? And the picture might give you a hint. Ben is loving this. It is Tracky. The other ones were on the Zoom call. All right, Ben knew that one, of course. So we're looking forward to, continuing this conversation on the COP. So one question is, how many members have joined in the last year? So as you can see, all these numbers are pretty high, which is really great. So 2,400, 3,000, 2,600, 2,800. And I don't even remember the answer right now. But it was round, like it was this number. Yeah, 2,800. Might be more now. This was done yesterday or the day before. Oh, Joe. And who has received the most likes on their COP post in the last year? So these are the 4 top ones. So if you see your name, great job. You're one of the top 4. So is it Ulanbek? Is it Jaime Bosque? Is it Gassim? Or is it Jets? Yes, as many know, it's our wonderful COP manager, Gassim. Applause for the great job he's doing. Oh. Okay, last question. Very, the standard question. Are you looking forward to annual conference next year? No or yes? I think we all know the answer. Yay. Okay, I don't even know. Okay, let's do the podium. 3rd place, Olav. 2nd place, Nassenef. I don't know who that is. So is there someone here? And then Ula, which we do have a couple of runners up. So I think Nassenef or maybe the runners up are the real winners. So thank you. This was the Kahoot. So then I think it's Max or Ula or.
View summary.
Oh, yeah. No. This one?
Or report. Okay.
Hey, who's the first one here that's not UIO? Yeah. Anyways, just for fun, because I forgot prices. So it's just for fun. Okay.
Free drinks, free drinks.
Yeah, free drinks at Songson. Free drinks and snacks.
All right, so we're just gonna move into the final slides of the closing. We want to start by thanking everyone for coming and being part of this. And that includes everyone here, also people who joined us online. We had a lot of great turnout online, but especially people who volunteered to come to Oslo to be part of this, who spoke at the event, who sent in your abstracts. You really make this event what it is. So it's great to have you all here. We got a lot of good pictures. We'll try to share some of these and hopefully have a photo album you can all contribute to. If you took great photos and want to share them, please tag us on social media or get in touch. And So we are updating our website with links to presentations. You can download those. We've done some of that already. So just keep checking back and send us an email if there's one that you're looking for that you don't see there. And we've already uploaded a lot of videos to the YouTube channel. So you can go to the DHIS2 YouTube channel, find the annual conference playlist, and that includes all plenary sessions and parallel sessions and the French recordings from the sessions that were interpreted. So you can go there and find those. And we encourage you to also just post about this on the community practice. So if you had a presentation that you made, or you have a question for someone who presented, that's a good way to follow up with people after the event, and also to share your own work so people can comment on it or ask you questions about it. All right, and Ola, do you want to talk about the social event?
Yes, thank you, Max. I think before we start talking about the fun, let's thank a few more people. Let's start with the technical team with Max, Grant, and the rest of the team. Big thanks, big thanks. We've had a lot of volunteers, so people that are normally programming or documenting DHIS have been supporting this. So to all the volunteers, big thank you. And as always, there's one special person that we need to give big extra thanks to, and that is Alice. So it's soon time for lunch. So as you know, we postponed the lunch a little bit so that you could fill up your stomach before you start to fill it up with other things a bit later. So right after this, we'll go over to the cafeteria, we'll have lunch. And then as you finish lunch, try to look for the dark blue badge or someone that you trust. And then you can walk down to the T-bane, the metro station. And this is important. You should go the opposite direction of what you normally do. So this is opposite of the city center. So it's on this side when you walk down. And then look for number 5, Songswan. Is that my phone? Yeah. Let's leave it here. So look for train number 5, Songswan. Songswan is the name of the lake. It's also the name of the final stop of that line. So it should be quite easy. So go to get off at the final stop called Songswan. And then, as you can see on the map here, it's just a short walk, 8 minutes, 700 meters. Down to the lake and then to the left, and then the DHIS beach. You can search for it on Google Maps. It's there. DHIS beach at Songswan. It's on the bottom left corner of the lake there. And there are people there already that have set up a nice camp for us. Okay, and we will serve drinks and snacks. Unfortunately, no barbecue this year. It's been very, very dry. So there's a total ban on all kind of fire barbecue in the forest, and we're in the middle of the forest up there. So we need to be careful. So to Bob and John and other smokers, please be careful with your cigarettes, okay? And then another very serious comment is that we had some unfortunate incidents, behavior that we don't accept here last year of sexual harassment. So please respect each other, treat each other nicely. We're from many different cultures, backgrounds, and gender. Be nice to each other and have a good atmosphere. We had a great atmosphere all week, and let's continue the good atmosphere up there. As it's hot, we have drinks, but please treat each other with respect. Thank you. So thanks to everyone for joining, flying all the way up to the warm north of the world. We have amazing weather this week. Thanks for coming, and we haven't finished yet. We have many hours of socializing and networking to do up there. Enjoy his speech and see you up there. Thank you.